Welcome, everyone. My name is Keisha Russell, and I'm a Regional TANF Program Manager in Regions VI and Region VIII. I am so happy to be with you today. Welcome to our Regions V through VIII State Virtual TANF meeting entitled Working Together to Find Solutions to Customer Needs. We're so excited to be able to bring this meeting to you all today in this virtual setting to come together and talk about TANF, to talk about customers' needs, to talk about employment, and kind of working through getting past where we're now at the tail end of COVID. We are happy to be able to bring together somewhat of a different type of agenda to you this year. We decided to try something a little new. And so we have 2 days of what we're calling concurrent sessions. So you'll see 3 sessions, one including State TANF Essentials, a session titled For the Shifting to this Virtual World, and then a session on refocusing our customer experience. Those sessions will happen for 2 days. And then after that, we're lucky enough to have our peer-to-peer sessions. And our peer-to-peer sessions this year are geared towards the work that you do there at the state. So we have peer sessions for those of you that are in leadership and administration, peer sessions for people that work with data and analytics, and then also peer sessions for those who work within case management. We decided to try this because oftentimes we come to our meetings and when these meetings are in person, we're not able to accommodate such a large number to have all 3 different groups being represented. But since we're in a virtual world, we thought, well, why not try this and open it up to more people so that others within the state can have an opportunity to come in and sit in on these meetings and also to meet with their peers across our regions, our Regions V through VIII. So we're very excited to have all of these groups represented today, and we're hoping that everyone will really be able to get something out of it, something that speaks to the job that they do, that you'll be able to meet your peers, and that you'll be able to take back new strategies, new ideas, and new relationships to the work that you do. So continuing on, we're really excited today to be able to inform some of you. I think most of you now know, but we're really excited today to be able to let you know that OFA now has an office director. We're so excited to have her join us today. I think this is probably her first official assignment as the OFA director. So I kind of feel honored that she was able to join our meeting today. Our new OFA director is Ann Flagg, which I'm pretty sure some of you already know and know her more than what we do, but we're very excited that she is with OFA. Prior to Anna's appointment, she served as the Senior Director of Policy and Practice at the American Public Human Services Association. In this role, Ann led ASFA's policy and practice supports to state and local public human services agencies across child welfare, child care, economic assistance, workforce and family supporting systems, and agency administration. She also led ASFA's work in designing national peer learning networks, advancing human services policy solutions across state and federal partners, and delivering technical assistance and leadership development support to state, local health and human services administrations. Prior to joining ASFA, Ann served in several leadership positions in the Maryland Department of Human Services, providing program leadership to the state's economic and emergency assistance, as well as child support, child welfare, and child support programs. During Ann's tenure in state service, she focused on cross-program and interagency initiatives, including workforce development systems alignment across TANF and WIOA agencies, and oversight for the state's Interagency Council on Homelessness and Commission on Intergenerational Poverty. Ann also brings with her more than 10 years of program management and external affairs in nonprofit and philanthropic sectors, including design and administration of workforce development, child welfare, behavioral health, and housing direct service programs in Greater Baltimore. And I'm actually tired after reading all of the great work that you have done. This is why at OFA, we are so excited to have Anne joining us as our office director. Now I would like to turn it over to Anne to give us a brief welcome.
Thank you, Keisha. So good morning, good afternoon. It's such an honor to be here with you today. So as Keisha said, I was appointed yesterday. This is literally day 2, so please bear with me. But I really couldn't think of a better way to kick off my first week here at OFA than in joining you today. As some of you have just heard, I served as a state TANF administrator, oversaw the economic supports programs. Very early in my career was a case manager, program manager. So I bring full appreciation to the critical importance of the roles that each of you serves in building well-being for the families you serve and the communities that you're a part of. All right, so with that, let's see. I understand that we've brought together here TANF administrators, program leaders, frontline specialists to discuss a variety of issues facing the families we serve every day. Looking at this agenda, I'm excited to know that we're touching on critical and pressing topics from our programs, while also engaging around many of the strategic goals that we aim to address here at ACF and OFA. Our priorities at ACF are driven by a commitment to advance equity and reduce structural barriers that prevent social and economic well-being. The pandemic and subsequent economic recession have highlighted the fact that human services programs have not always served families of colors and other underserved groups particularly well. With TANF's focus on assisting needy families, promoting job preparation, and encouraging healthy families, your efforts, your innovative program solutions, and your holistic community partnerships are uniquely positioned to help social services systems as a whole explore, address, and break down longstanding challenges. We all know, and at ACF prioritize, that as a community and society, we must use whole family approaches and community-led strategies to help increase economic mobility. This week's convening will allow us to share strategies and gather feedback on our efforts to create environments where children, youth, families, and individuals can collectively thrive. So we definitely want to hear from each one of you throughout this event. Please share your successes, your challenges. We're listening with open ears and open minds. This week, you're going to hear from a mix of peer programs and researchers focused on strengthening how TANF has and will continue to respond to the needs of families, but also learn from your neighbors and new strategies for addressing program concerns. From pivoting to virtual service delivery, improving customer experience, and focusing on equity and inclusion for all, TANF is at the forefront of serving families. Between workshop sessions, you'll also have focused peer learning for you to share strategies and innovations with your colleagues and in between and across your regions. So many facets in our lives have been interrupted over these last 2 years, from our schools to our workplaces and even our access to the most basic of necessities. Stressors placed on families, and particularly low-income families, have been significant and overwhelming. I hope this week helps each of your states move forward with innovative and customer-centered approaches to supporting families and achieving financial stability. I would like to thank all of you for being here today, leaning in, your dedication and your hard work supporting families. We value the work that you do every day. And thank you to the regional staff from Regions V, VI, VII, and VIII for working to make this important meeting happen. I look forward to getting to know each of you over the course of my appointment, and certainly excited to hear what we learn over the next couple of days. So with that, turn it back to Keisha.
Thank you, Anne. Again, from everyone at OFA and all of our state partners, we welcome you to the Office of Family Assistance.
We are going to have a small little section from me just giving us some context piece, some common language and some framing, and then Gerard and Aaron are going to share with you their experience in implementing some of these customer-focused principles in practice in the great states of Michigan and Vermont. In order to orient everyone to that content, I'm actually going to do the introductions here at the beginning, so you know who's coming up. And then once that sort of housekeeping piece is out of the way, we'll be able to dive right into the content. We have tons of time reserved at the end for questions, and so we will welcome your questions as we get a little further along. And because Gerard and Erin have such cool experiences, I do have some notes up here that I'm going to make sure that I don't miss anything. Give me just one second. Okay, so first up is Gerard Johnson. Gerard is the Director of Programs for 3 of the 5 counties that make up the Great Lakes Bay region here in Michigan. Gerard is an alum from Saginaw Valley State University, where he earned both his Bachelor of Arts in Communication and then also a master's in the same discipline. You'll notice that about Gerard when you hear him speak. He's been a partner in workforce development for more than 15 years in positions from job search instructor to coordinator to community liaison and assistant manager, and is an active member of the Saginaw Housing Commission and the Downtown Saginaw Association. Gerard is married to his beautiful wife, Julie. They have 3 wonderful, beautiful children. He's an avid sports guy where he coaches his son's youth basketball and football teams. Big sports fan. I joked yesterday that he and I share a affection and the great state of Michigan for sports, but we cannot get together on the Detroit Lions. Gerard, what I didn't tell you yesterday is that I am a birthright Bears fan. So not only are we, I know, but we're gonna have to work through it, friend. We're gonna have to find a way. And also something we do have in common. Gerard enjoys spending time with his family, playing basketball and bowling. Then next up, we have Erin Olicken from Vermont's TANF program, known as Reach Up, where she has spent 18 years moving up from case manager to her current role as the director. Erin is especially interested in designing programs that work for participants, which you'll hear very clearly in the words that she shares with you later, orienting all of that work to concepts of behavioral science and trauma-informed care. Erin works hard to promote social and economic justice, providing opportunities within Reach Up to help participants develop skills and resources that promote long-term financial stability for their families. Reach Up actively engages community partners, participants, and staff around innovation and improvement. You'll hear about the journey that the program has been through with Mathematica and then on their own to implement a mission, a vision, a strategic plan, and assessment process focusing on goal achievement and important executive function skills. And all together, you'll hear the story of the shift from a compliance-based TANF program to a coaching model, which helps families establish their own goals and meet them. And Erin's background is in sociology from Kenyon College, and she holds a public manager certification. So that is a bit of introduction of our wonderful speakers to come. We're going to go ahead and go on to the next slides, and I will share with you, just keep going until you get to that one that talks about what we're going to talk about. There we go. We're going to start here with this, some foundations around customer-focused case management with a specific lens toward the TANF programs that y'all are working in, these principles of authentic engagement. So we can go to the next slide, please. So for folks who I've had the chance to work with in the past, you've heard me talk a lot about the importance of why. If you are the type of person who enjoys a good TED Talk, I can recommend without hesitation Simon Sinek's Golden Circle, where he talks about the importance of why. So whenever I'm doing presentations and trainings on this topic, I really like to start with this really important foundation of centering the customer and the respect of the inherent dignity of working with other humans, right? So we have a long history in public benefits around judgment and desert and qualification and eligibility and a lot of words that can be fairly dehumanizing. And so as we move towards this more authentic engagement, we're moving towards a programmatic environment of empowerment and self-direction. But in order to have an empowered self-directed experience, we first have to have this universal regard of the inherent dignity of both folks in any given environment, right? Erin said yesterday, and I don't want to steal any of your words for later, Erin, but you talked yesterday about sitting on the same side of the desk. And I think that's a really powerful example of what we're talking about here. So if our why is to really center the customer in their own journey, yes, absolutely, I will do that in the chat for sure, is to move towards customer-focused case management as a strategy and a set of tools, right? So this is about what we're going to do. We're going to center, these are active verbs, we're going to center the customer as the primary decision maker. Right? This isn't lip service. This isn't sort of pedantic. Yes, we're going to do this modernized thing. This is a really active decision to elevate the decision-making primacy of the participant, to develop a collaborative relationship between the participant / customer / client / neighbor. I know folks use lots of different terms, right? So we want to make sure we're being inclusive of that we're responding holistically to a holistic set of needs, that families come with an entire lived experience that is different and unique, but also valid and deserving of respect. And similarly, their cultural norms and the ways that they interact with the world are universally valid as well, and that we aren't in a position of expecting or demanding a certain way of interaction in order to demonstrate validity in the conversation. We want to make sure we're operationalizing those trauma-informed approaches. I can do a quick teaser that OFA is going to have some additional resources for y'all about that in the coming months, but we are in an active business of psychological and physical safety in all interactions with folks. And what all of that allows us to do is move towards a very data-driven continuous improvement model. All of these precepts are founded in data that we already have, right? And every interaction that we're having holistically with a participant allows us to contribute additionally to that data and work towards a continuous improvement model. So how do we do all of that? So some additional active verbs here. Moving towards coaching as case management, you're going to hear Gerard and Aaron talk extensively about coaches and the coaching approach. Implementing a holistic appraisal so we have a robust understanding of what's going on. It's very difficult, for example, to navigate your way to Disney if you don't know that Disney is in Florida, or you don't know that Orlando is in the middle of the state, or you don't know that you want to go to Disney. Right? We have to understand the holistic position of a given customer. Using motivational interviewing techniques that allow us to actively listen, to understand and promote internal motivation, and to have the tools at our disposal that illuminate for a participant when the choices that they're making might be not related to the objectives that they've set. So those are two really important pieces, right? It's not that what the customer is doing does not get me where I want the customer to go. And it's not where the customer wants to go isn't where I want them to go. It's the customer has told me where they want to go. And I can now use this technique of motivational interviewing to perhaps illuminate with a customer that their immediate behaviors are not in advancement of their own long-term objective, right? So that's the relationship that motivational interviewing allows us to create. And then very importantly, recognizing and responding to secondary traumatic stress. We know that about 70% of folks have a history of trauma. I for sure will on the TED Talk. And we know that that is even a greater number often in the helping professions, right? That folks who self-select into this business are often helpers at heart who bring a history of some type of trauma. When you couple those things together with high caseloads and very needy families and crises and public health emergencies and global pandemics and hunger and strife and gas prices and inflation and all of the things that people are living through, the risk of secondary traumatic stress, we used to call this compassion fatigue. So if these words aren't resonant for you, we used to call it compassion fatigue, right? Is very real. And not only is it toxic for the case manager, supervisor, and leaders who are navigating through it, but it's doubly problematic in that it erodes the ability of those professionals to meaningfully serve their participants, thereby almost perpetuating itself, right? You're generating additional need, you're generating additional trauma, and then you become in the business of actually victimizing folks again with absolutely no intention of having done that. So really getting to a place where we understand and respond to that secondary traumatic stress so that we are practicing what we're preaching. We're coaching our people so that they can coach the customers. All right, one more slide from me, and then I'm going to turn it over to the real experts in the field. This is a quick, more of a takeaway slide that is for folks who prefer a this or that kind of way of understanding content. If we could go over forward one, there we go. Traditional case management on the left and customer-focused case management on the right. I know this is a lot of words on the slide and you're probably reading them right now, but the key takeaway from this slide is when you're finding yourself evaluating a choice about this or that, you want to be looking as far along the spectrum to the right of a participant-owned, participant-driven plan and experience as you can get, understanding the operational context that you're working inside of. I'm going to pop over into the chat and address the couple of questions that are there and give you all a link to the TED Talk to watch later. And in the meantime, I'm going to hand it over to Gerard, who's going to share some experiences from our great state of Michigan.
Good afternoon, good morning, depending on where you are at. Again, my name is Gerard Johnson. I am the program director at Michigan Works for 3 of our 5 counties, Saginaw, Midland, and Bay. Today, I would like to discuss and go over some of the things that we are doing to change the client experience. 3 of the things that I'm going to focus on and talk about this afternoon are increasing the virtual options that we've offered, introducing Go For It as a career coaching model, and reducing the amount of forms that we have been using in our programs. You can go to the next slide, please. And the next slide, one more. Thank you. So the first thing I would like to talk about is our increased virtual options. During the pandemic, one of the things that we did was try to increase the amount of services that we offer virtual due to our service centers closing, as well as staff working from home. But once we were able to come back into the office and offer our services in person, we wanted to remain virtual as much as possible to offer this option for individuals who have barriers that prevent them from coming to the office. So one of the things that we did in the beginning was record all of our workshops and offer them on demand on our Michigan Works website. All of our workshops were recorded and people could go and watch them as they pleased at any time that they chose. We've found and learned that that was very beneficial. Another thing we did was to create our workshops and present them virtually. So individuals who aren't able to come into the office, because we understand, again, there are some barriers that prevent our participants from coming to the office, whether it be transportation or childcare. And the County of Saginaw doesn't have, or the Great Lakes Bay region in general, doesn't have a really robust public transportation system. The bus runs at certain times during the day. There's no times during the evening. So we wanted to try to eliminate that barrier and offer these workshops virtually. So over the pandemic, a lot of people became proficient with Zoom, Microsoft Teams, WebEx, all the other virtual options. And we utilized Zoom to present our virtual workshops. Not only are we offering our workshops virtually, but we are providing services virtually as well. So orientations, we are providing virtually. We are offering career coaching appointments. Those are being offered virtually as well. Again, to try to eliminate the barriers that some participants may have to getting to the office, as well as some people just, still aren't comfortable being in person. So we didn't want that to continue to be a barrier. So those are the virtual options that we have created to try to increase, to change the participant experience within the Great Lakes Bay region of Michigan Works. You can go to the next slide, please. The next thing that we did was change our entire organization from a compliance model to a transformational model using a program called Go For It. We partnered with a company called Mathematica to change to a more human-centered approach. Now, we are in Michigan still held to the work requirement, so that is still something that we have to focus on. But we're working on a way to figure out a way to work with our participants. And the overall idea is that the goals that they set for themselves will ultimately lead to participation in core activities that will lead to compliance and ultimately satisfy the WPR requirements that we are held to. So the goals that we are working with individuals with, they are setting their own goals and letting us know what they're interested in doing and working with them and meeting them where they're at. So what is Goal For It? The model that we're using, it's an evidence-informed, customer-centered framework for setting and achieving goals in human services. You move to the next slide, please. Goal For It focuses on improving the outcomes of children and families using 3 primary strategies. Those strategies being reducing external sources of stress, especially those stressors associated with poverty, creates responsive relationships within and beyond the program. One of the goals of the program is to build relationships between the career coaches and their participants so they feel more comfortable and open to share their goals and their aspirations with their career coach, so we can really work towards the things that they are interested in, and also taking the skills that they have learned with us and moving them and utilizing those skills with their own families, with their kids, to help them set and achieve goals. And also it strengthens core life skills. Next slide, please. So Goal For It focuses on self-regulation as a 4-step problem-solving framework. Self-regulation refers to a set of cognitive skills, emotional skills, and personality factors that allow people to control thoughts, emotions, and behaviors. And the activities and tools in Goal For It embed that skill building into its framework. So by setting goals and taking action to achieve them, customers are practicing the skills critical to building long-term capacity for achieving economic independence. So the 4-step problem-solving framework that we utilize is goal, plan, do, review, and revise. So ultimately, an individual will come in based on their interests. They'll work with a career coach. Career coach is going to ask open-ended questions to find out exactly what is this person interested in and what direction would they like to go in. And again, it's important to focus on what the individual wants, because their motivation is going to be higher to achieve the goal when it's a goal that they have set for themselves. So we want to find out what is interesting to them, something that is a little complicated or hard to achieve, but yet it is manageable. So they work with a career coach to put a detailed plan together on how to achieve that goal. We send them out to go start working and execute the plan. And depending on each individual situation, the participant may need to come in weekly, or they may need to come in bi-weekly to review and revise the progress towards the goal that they have set for themselves. In some situations, we might find out that the goal that they have set may not be really what they wanted to do, but something that they thought they wanted to do, and that's okay. The idea, again, is to work with and towards something that they are interested in, so they have that motivation to continue to move forward. Next slide, please. So this was something that was completely new in our organization, and what we wanted to do was to get complete buy-in from everyone who was going to be involved. So not only did our career coaches learn this career coaching model, but the process started from the top down. So the process started with me as a director and going through this process with my leadership team. And the leadership team then taking the things that they've learned to their frontline staff, and ultimately now the frontline staff would be working with the participants. And this was, we did this purposely so we could have complete buy-in, so everyone from the top down understood what Goal For It was about, what motivation-driven leadership was about, and the best way to incorporate and use Goal For It in our TANF programs. Another thing that we did was not only incorporate Goal For It in our TANF programs, but in all of our programs. So it was a complete culture change in what we did within the Great Lakes Bay region of Michigan Works. But to get this process started, to find out if this was going to work and how it was accepted by our program participants, we conducted what was called a road test. The road test was conducted over a 4-week period where all of our career coaches chose at least 4 to 5 participants to use, go for it on, and surveys were conducted by staff and participants after each meeting. Next slide, please. What we wanted to find out during this road test was if the tools and forms that we had and that we were using in the meetings were simple and easy for them to understand. We wanted to know if they felt comfortable speaking with their career coach about their goals. We wanted to know if the meeting helped build stronger relationships with their career coach. And we also wanted to know if the meeting helped them identify and make progress on goals that were important to them. Next slide, please. So as you could see from the graph that we had amazing results. The response that we got using this new career coaching model with our participants was overwhelmingly positive. They really felt the difference in the way their career coaches were working with them, staying away from letting them know the amount of hours they needed to remain in compliance. And if you didn't do this, then you could face a sanction. We went changed from that negative communication to a more positive, again, finding out exactly what was important to them and what it was that they wanted to work towards and what were the goals that were important. So overwhelmingly positive in the results from the road test. Next slide, please. So I wanted to share some of the feedback that we received from our program participants during the road test. So we offered a survey, and the survey was just for them to ask questions. But was awesome about this was that they took the next step to give us additional feedback, and that just let us know how positive the effect of this change was. Because you take a survey, and a lot of times, and I know I'm guilty of it as well, that you just do the questions that were asked and, you know, you leave it there. You don't go the next step to offer any additional comments. But the fact that our participants gave us additional comments let us know how effective this new career coaching model was. And not going to read them all, but want to focus on this bottom one where the participant said that, quote, "I feel as if my goals are the #1 priority. My career coach understands and expresses that." So it just they felt that we were interested in what was important to them. And that was giving them that motivation to continue to strive towards their goals. Next slide, please. Another quote from a career coach, and this is what she heard from a few of her program participants. She's heard, quote, "I heard from participants that they're really happy that it doesn't feel like a punishment for needing assistance, but someone is actually helping me find what I want to do and go out and do it, and they are doing it." So that punishment, you know, we learned that the language that we were using in our orientations about the amount of hours you're going to have to do and the core activities you're going to have to participate in the event that you don't do that, then you could find yourself in noncompliance and end up in a sanction. We learned that negative language is a turnoff a little bit. So changing our language to a more positive approach had a significant effect in the participant wanting to continue to move forward and work towards the goals that they have set for themselves. Next slide, please. Changing our virtual options as well as changing our career coaching are two of the ways that we have changed the experience. Lastly, what we wanted to do was look at all the forms that we offer that are required to have our participants fill out, and look at if the forms that we are using, are they mandatory? Do we have them do it for our own personal internal use? What are the reasons? So we went and we looked at every form that we had participants use. We did not want forms to be a barrier to participation. So what we did was looked at our forms, of all the service that we provide, and we wanted to make them more inclusive by adjusting the language in the forms, by adjusting the format on the forms, and as well as creating fillable forms. So what we were able to do with this form reduction, again, this was a project that we worked with Mathematica on as well. So we analyzed 196 documents across all of our programs in the Great Lakes Bay region. And we were able to modify the content of 14 forms. We combined 41 forms into 5 forms. So we ultimately were able to eliminate 34 forms. We redesigned 19 of them and make them 508 compliant in English and Spanish. And again, as I mentioned, created 11 fillable forms in English and 10 fillable forms in Spanish. So again, we wanted to do that to make the forms more inclusive, eliminate any confusion that the forms had, remove any barriers that the forms may create, because if we're duly enrolling someone in a program, sometimes you have to fill out a form for this program as well as the same information for this program. What we learned is that the amount of forms that we had participants fill out were actually creating a barrier, and we were losing participation that way. So I wanted to take a look at that and do that as a way to improve the client experience. Next slide, please. So our next slide, the next steps that we are looking at is continue learning about what's working and what isn't working within our programs. So we're looking to create work groups of TANF participants to continue learning what's working and what's not working. Possibly create a council for them to let us know, what's working and what's not working. This is a continual learning process, and we're always learning to improve the process. But what's different about what we're doing now versus what we've done in the past is that we are including the participant. So they will be at the table when we are working to make improvements, and the improvements that we are making are going to be directly related to the information that we receive from our program participants. So those are the things that we are doing in the Great Lakes Bay region to change the client experience and try to make what we're doing more human-centered and less transactional. Thank you.
Awesome. Thank you so much, Gerard. Every time I hear you share about those forms, I'm struck anew at, I think we've all had that experience, right? I think for most people, either the DMV or the IRS are probably coming to mind right now, right? We've interacted with some bureaucracy where we've been required to multiply input information, and it is exhausting. And that's for folks who potentially aren't experiencing trauma and compromised executive function. So I think, particular shout out about how important it is to remediate those barriers. So, and I do apologize. I turned my video off to put the link that was requested in the chat and then didn't realize I hadn't turned it back on. So hopefully you were watching yourself talk that time, Gerard, and not having watched me while you were talking. So we're going to turn to Erin from Vermont up next. And I'm very excited to let you all hear from the Reach Up experience and what they have to share. Erin, I'm going to hand this right over to you.
All right, thank you. So my name is Erin Olicken. I'm the director of the Vermont Reach Up program, which is the Vermont TANF program. And I thought I would start out telling you a little bit about what our program looks like and kind of the journey that we've gone through in the last 5 or 6 years to develop a more client-centered approach or customer-centered approach. In Vermont, we haven't been focusing on the federal work requirement for a while now. It's been a kind of informally though. So mostly kind of similar to how Gerard was talking about, really just kind of shifting some of the practice and the language and turning it more positive and focusing on what is right for the family in that moment as the family defines it. So our case managers have a very kind of whole family holistic approach to working with participants. And then we also actually have contracted employment training and education specialists who focus more on specifically on employment training and education. And our case managers are all trained in the process of doing the goal, plan, do, review, revise method. And we use an assessment called Stepping Stones, which we developed with Mathematica and also went through a road test process with them about 5 or 6 years ago to develop that. And so all of these things put together are really add up to a coaching model, which is where we've kind of been transitioning and continuing to work towards and improve in Vermont for our case managers. I do want to note that we still call our case managers, and it's something that we're looking into changing, because I think that the name really does, language is really important, and how we describe our roles can affect, how people feel about working with someone, or kind of the approach to what is this service that I'm going to be getting, or what is this program that I'm going to be working with. And so I really love the career coach name that you have in Michigan. And I don't know what we'll end up with, but we are going to look for something different in one of our next steps. And then all of our case managers are also trained in motivational interviewing. And so really asking those open-ended questions, drawing out intrinsic motivations. And all of these things together really help people build those executive functioning skills and those responsive relationships that are so important to help people develop their goals, move forward, feel like they can trust this coach or case manager that they're working with to join them as they move forward and achieve their goals. Now, as of now, we do still have a work requirement in Vermont. However, our legislation is changing. And this past legislative session, Vermont passed a bill that will completely shift the model in REACH-UP to a coaching method, and it will eliminate the work requirement as we know it. So there will still be an engagement requirement and participation expectations, but the family will get to choose what that means to them. And that will now be in our law. And so we will not be following specifically, at least on the front end, in how we work with the family. We won't be using the federal work requirement to drive that. And I can talk a little bit more about how that will work, but I did want to just mention kind of how we got there for those, if any of you are interested in kind of pursuing some of that, I think that this is the time. And Courtney mentioned something yesterday about COVID really helping a lot of people to kind of understand what is it like to have to struggle and to have to kind of live in this state of scarcity, and having a greater understanding now. And I will say that we used data to show that people were actually more engaged in this last 2 years during a time when there was no work requirement. Everyone was deferred from the working requirement. We saw increase in participation in showing up for appointments, virtual appointments, doing vocational education, enrolling in college, doing self-employment. And so all of those things happened purely through coaching and using a goal achievement method, and by tapping into people's intrinsic motivation and just asking people, what do you actually want to do? How do you envision your life? And this legislation actually passed unanimously through the Vermont legislature. And so it was completely in Vermont tripartisan. We have progressive Democratic and Republican parties, and not one single person voted no. So it is a time when I think that people are very amenable to listening to what is the science, what does the data tell us, and what is actually going to help people to move forward and achieve their goals. Next slide, please. We worked with Mathematica as well, and one of the first things we did with them was to develop a mission and a vision for our program. And this is where our mission for REACH-UP is that REACH-UP joins families on their journey to overcome obstacles, explore opportunities, improve their finances, and reach their goals. And this is where, as Courtney mentioned, that joining means sitting on the same side of the desk. And so we aren't looking to tell people what to do or to drive what we think is best for them. We're looking to help people, to draw out of people, what do you think is best for you and your family, and how can we help you get there? And so what we did in this process of developing a mission and vision was, it was a very collaborative process that included staff and community partners and reach out participants. And so we really wanted the voice of people who were accessing this program to tell us, does this mission mean something to you? Does it resonate with you? Do you think that this makes sense? Next slide, please. And this is our vision that we developed together, is that families will be empowered, connected, and thriving. And we just wanted something very simple and aspirational that would resonate with Vermont families. Next slide, please. So the reach up frameworks that we kind of operate under are that we are mission and vision driven, and having that mission and vision has really helped us to kind of go back to that and say, is this something that is at the core of what we should be doing? Is this something that makes sense? Is this new initiative mission driven? Does it work with how we have decided we're going to do and our values that we share? We're trauma responsive, and the coaching model and the goal-oriented approach really is a trauma responsive model, because it empowers people to make their own decisions, gives choice where choice is available, and as much as possible takes out a lot of the kind of prior punitive compliance-based approach, which can do more harm than good in a lot of cases. And also science informed, and all of this is informed by science, and these methods are evidence informed. And so using that as much as possible, using the data to show this is what works for families. So we had a couple of examples of initiatives that complement these frameworks in Vermont for Reach Up. We have a financial empowerment program, which allows people to learn about their finances and set financial goals and earn incentives for those. They can do things like open a bank account and we'll match their savings up to a certain amount, or work on addressing credit. And participants have found that really helpful and empowering. And then we also brought a program from Yale University to Vermont called the Moms Partnership, which is a cohort peer facilitated mental health and stress reduction modules that allows moms to get together and be able to work. It's actually cognitive behavioral therapy based, and that has been shown to increase the number of hours that moms work once they've completed those modules. Next slide, please. I like to think of, every family needs a sturdy foundation, and this is something that is really needed for employment and to be successful in employment. And so some of these things are just examples of things that are necessary in order to be successful in the employment world. And I think sometimes there are things that we think, well, that's not really our job, or that's outside of our purview, whether it's mental health or arranging transportation, or even as simple as building those responsive relationships. But when we build those responsive relationships between a coach and a participant, not only are we creating a trusting and trauma responsive environment, but we're also modeling the kinds of behaviors that you need in the workplace, and also things that you need in your home to be able to, parent your kids and have those responsive relationships in your home. And so all of these things are connected. And I like the kind of analogy of having a foundation so that it's apparent that there are many things that we need to work on in order to be ready for employment. And if your roof blows off, it's going to be hard to go to work the next day. Next slide, please. And this is just kind of a visual about a spectrum of employment and a continuum of employment, and kind of all the different things that go into that. Kind of building upon the last thing, thinking about all of these different aspects. And of course, this isn't an exhaustive list, but these are just some of those things that commonly come up. And these are all things that our case managers will work with families around. And so, for example, one of the fortunate things that we're really lucky in Vermont is that if somebody technically should be needing a work requirement, but they have just disclosed that they are ready to get treatment for their substance use disorder and they need, intensive treatment, we're going to do that. And that's what we're going to focus on, because we want to be there in that moment for when that person is ready for that change. If there's something like that that's going on, or for example, housing, we also do housing case management. So we're working with families on finding sustainable housing and maintaining their housing. So I wanted to just kind of talk briefly about some things that that you can do regardless of whether or not you have a work requirement or what state you're in, because there are lots of things that you can do even if you haven't gone through this big process within the program that you're in. And so one of the things that, if at all possible, to use sanction as little as possible and really build that accountability internally and help people, that accountability is built through responsive relationships. We don't want to disappoint each other. It's built through, what is that feeling of kind of like, I have something hanging over my head, I want to get that done, and helping people to build other social connections so that they can find accountability in ways that are not just external. And then there are a couple great websites. Mathematica.org has some great information on goal for it if you just kind of want to peruse that. Also, gpdrr.org has a whole, you can do a self-guided training on how to use the goal plan, do, review, revise method. And you can do that, no matter what your rules and regulations are for your program, you can incorporate elements of that, and also elements of motivational interviewing, which is really just, Courtney had talked about some of the main elements of that. And then it's really just about making sure, you're asking open-ended questions, showing empathy, listening more than talking, things like that. And as for if you're a manager or organizational leader, I think the first thing is to hire for coaching mentality. So making sure that when you're hiring people, you're looking for a growth mindset. Do people have a universal high regard of the people that they're going to be working with? And are they non-judgmental, good listener? Carving out time and space for your coaches and case managers to focus on training and their own growth. So even something as simple as, make sure they can watch that TED Talk that Courtney put in the in the chat, or if somebody is a big reader and they want to read an article, making sure they have a little bit of time to be able to read that, or to do that goal plan, do, review, revise module training. Things like that can really help. And then to use science and data to show how coaching and the client-centered approach works. Putting clients in the center also means that we're involving clients in or customers or participants in the planning process, and hearing their voice and elevating their voice when you can to anyone who will listen, who might have the power and authority to be able to affect policy change. And that's something that we did in Vermont, is we were able to show that we were still able to meet the federal work participation rate without enforcing a work requirement. And so, kind of being able to pull all those pieces together to support, what the evidence shows us, and support your staff and participants in moving forward, I think are just key points. So thank you.
Great. Thank you so much. We're going to move into Q&A here, and there is one in the chat, which I'm going to read out here in just a moment. Before I do that, I think it's, we opened this session, Karen did, with the questions about self-care. And I think it would be remiss if we were to let this session go by without saying that we can't expect our workers, our coaches, our case managers, whatever we're calling them, to actively coach and support and center the participants, clients, customers, neighbors, or whatever we're calling them, if we're not also pouring in those services to those workers, right? That's where the secondary traumatic stress piece comes from. I chuckled a little bit because literally the only video that I want to watch, I think, is that Simon Sinek one. Everything else I want to read. I'm a reader by orientation, unless it's football season, Gerard, then I've got the TV on. But I think it's super important that this isn't all, chunks that are all separate. This is all a quilted together solution to how we engage in a more authentic way. And so that's why the very beginning title slide that I was talking about was about the sort of precepts of authentic engagement, right? And I think sometimes we end up focusing on the tactics, and we say things like, these are our mores for how we're going to engage virtually. These are our norms for how we're going to participate in a room. This is our structure for how we're going to run a meeting. And all of that is valid and important. But if we're not having a larger conversation about the environment and the philosophy that we're operationalizing, I think we're going to miss something really important. So let me read this question that's in the chat. I'm going to ask Gerard, you and Aaron to put your heads when the question came in, which was you were talking about sanctions and the customer choice. And then I'm going to refrain from changing the words in the question and just read it as it's provided. It says, I like this method, but my question is, how then does the customer know they could choose to have the benefit stop? Because we have sanctions, do we just trust they will read that? I know our state says we have to inform them of the consequences of the lack of participation.
Yeah, and we still do let them know what the consequences are. It's just the way it's communicated has changed. It's just a little softer message, and it's not at the forefront of of the orientation. It's not the waving the finger. If you don't do this, then this is going to happen. It's just we've changed the just the way that message is communicated. So they are aware of consequences. They do are informed of what could happen in those sanctions. When they meet with their career coach, the options of closing their case is given in the ways that they can do that, and the best method for that to happen. So it's not that we're not letting them know the consequences. It's just the way that it's communicated has changed.
Aaron, do you want to add anything to that about, I know you said use sanctions as lightly as possible, but the orientation?
Yeah, so we do a similar, we don't have an orientation, but our case managers would talk kind of like, in the first couple appointments about what to expect. And that would definitely be part of the conversation. And it's also, we have shifted some of the language in notices and things like that as well, like appointment letters, so that to kind of take out things like compliance and, start with the positive and then go to here's what could happen if ... Instead of kind of starting with, if you don't show up, this is what's going to happen. And we are very fortunate that we are able to kind of try to re-engage people before resorting to sanctions. So we do have a conciliation process, and it's really just kind of a last resort. But yeah, I mean, we tell people that this is a potential consequence. We just try not to focus on it, as we hope we won't get there.
Right. And I think partly, so summatively, and then we're going to go on to the additional questions. There's a difference between the existence of a potential consequence and the motivation of the existence of that potential consequence, right? We all exist in an environment surrounded by consequences all the time. It doesn't necessarily mean that our behavior is governed by the avoidance of that potential consequence. And so we don't want to assume that participants' behavior is governed by the active avoidance of something unpleasant. They're very likely motivated by the same things that motivate us to get up and go to work every day, and simply require an environment in which they can prioritize what they think of as important. So Gerard, there are a couple of questions in the chat that are specific requests of you to share orientation videos and forms, letters, things like that. So I'll let you take a look at those and we can talk logistically about how that might work if you're able to do it.
Yeah, I'd be willing to. So our orientation is not recorded, so I wouldn't be able to share that, but I could take a look at our forms, and however they can be shared. I can do that and share the forms to show how we have changed the format and the language in the forms and make them a little bit more user and reader friendly. We do have a PowerPoint that we use for orientation, the PowerPoint. Again, the language has been changed to make those things a little bit softer. So I can share PowerPoint as well as those forms in a way that would get to everybody. So just let me know how that can be done, and we can definitely make that happen.
Okay, I think we'll figure that out on the meeting side. I think Pat is here and some others. We will figure that out. So let's just take that down as a yes. And okay, so next question. How long have Michigan and Vermont been doing these programs? How has federal work participation percentage changed in that time? Any data on the percent of the caseload that has been able to move off the caseload due to reaching self-sufficiency? Oh, Gerard, you're on mute. I just looked up and saw you. I realized you're on mute. There you go.
Know better by I should know better by now.
Right. We should all know better. And yet.
This is fairly new. We did a complete implementation in January of 22. When we first started in the training in March, that's when the work participation, March of 2020, was when we started learning and started our training of the motivation-driven leadership. And we have implemented that since January. So ultimately, from the beginning, because the work requirement was eliminated for so long, and then it started, so we were kind of starting at ground zero with that. So we're climbing, we're steady climbing. But what we have saw this over the past 2 months, we have seen a definite increase in our work participation in those programs. One of the things that has happened in Michigan, we are a pilot for transitional supportive services, meaning that we are able to kind of give, they're not really incentives, but we're able to tie gift cards to certain areas of achievement. So some of those things we have tied gift cards to are, participating in approved activities, going to workshops, and we are seeing, we're giving a lot of gift cards away for those individuals who are meeting those requirements. So with the increase in these transitional support services that we are able to offer and those setting goals, we are seeing an increase in participation.
Erin?
Yeah, in Vermont, so we first started by doing the mission and vision work, and then we went from there to doing some goal for it work. And so it's been a very gradual process, and throughout that time we were still measuring, there was still work requirement, we were measuring work participation rate, and then COVID happened, and it was during COVID that we started looking at those percentages that I mentioned briefly earlier about that we actually did see an increase in percentage of people accessing training, education, voc ed. I would say we did not see an increase in employment, but given the landscape at the time, that's not surprising. And so I felt very encouraged that people were taking the time to access education and kind of getting into training programs, because that will lead to better employment in the future. So I see that as an outcome that's just as important, if not more important sometimes, depending on what that employment outcome is. Like, is it going to be sustainable employment? We're still also working on what outcomes do we want to measure to see if this is working and how it's working. And so in terms of the work participation rate, our overall WPR that we, it either has increased or has stayed roughly the same, but we know that there are many, many things that go into the work participation rate. So when I say that, I'm not just talking about people participating in the federal activities. And so it is a bit convoluted. So it's kind of a hard question to answer, but we did see increased engagement, which I would theorize is going to lead to increased outcomes in employment and those things that we want to see.
Mm-hmm. So I want to also offer, so this is a multimodal, like most good human engagement things are. You may come off of mute if that's a preferred modality for you to ask questions. I also want to honor that there was a question in the chat that I think came in roughly the same time as the one y'all just answered about the impact on performance. My impression is that y'all just answered that question with your comments about outcomes. But if there is anything else you'd like to say about performance, or so the asker of the question is certifying that he agrees that you all did that. But I did want to at least mention that that had come in through the chat. Thank you, Ethan. Anyone else who has a question that they want to ask our esteemed panel here? Because if you don't, I'm going to talk some more. So there you go. There's your consequence that happens if we don't if we don't participate. No, while you all are getting your thoughts together, a couple of observations from me about things that I've heard and the questions that are being asked. You know, I think that from an organizational change perspective, and Gerard and Aaron, I'd love your reflections on how this has happened in your home organizations. Aaron, you mentioned it in hiring, right? That there's absolutely a space in which some folks will simply not thrive when you change the fundamental requirements of their job, right? And that's not an unreasonable expectation, right? It's not an unreasonable thing to have happen if you hired with a particular focus on eligibility. We have incredibly valuable skill sets that are folks who operate off of a checklist, right? That is a skill set that is valid and that matters tremendously, right? There are positions in this world where compliance focus needs to be at the forefront. Air traffic control comes to the top of mind, right? We want people who are paying very strict attention to a checklist. So there's, can you all reflect a little bit about what it looks like to go through an organizational change part of this journey?
Yeah, so initially, when we said that we were going to move to this compliance, more human-centered model of career coaching, I was on board because I was introduced to this at Michigan Works Conference, and the way that it was presented, I was sold immediately. I thought it was awesome, and I was like, this is what, you know, we really need for our program participants. But when we brought it back initially, career coaches thought that what we were doing or what we were telling them is that they weren't doing their job well enough. So we need to change. We had to completely change that mindset of that's not the case. It's not about you. This is about our program participants. And it was hard for them at first, especially in our TANF programs, because for the longest time, the way that they were measured was their work participation rate. So we required them to hold a certain percentage on their individual loads of people who were meeting participation. And then ultimately, if you have that certain number on your load, then everyone else has that certain load, then we're going to reach that goal that we have set for ourselves for the work participation rate that we were trying to achieve. But when taking that away, they didn't know what they were being measured on. So without that, it was hard for them to know whether or not they were doing their jobs well or if they weren't. This was a brand new mode of career coaching. So they really didn't know how well they were doing it. Something that we did that I didn't show was part of the road test was to ask the staff how they felt when they were implementing Goal Forward with the program participants. And the results were that they didn't feel comfortable and they didn't feel that they were making a difference. They didn't know if they were building relationships. So what was cool was to show them, even though they felt the way that they did, to show them the results of how the individuals that they were working with and how what they were doing was really impacting and changing the way that they thought about participation. So we were able to conduct those road tests and have results and surveys and statistics to show that you are really making a difference. And this is kind of what we're looking at. We're looking at these individuals and how are they setting and achieving their goals. So try to step away from work participation and step towards just that individual time and relationship building with the participants that you are working with. So that was kind of the hardest thing, was getting them to kind of step away from what they've been measured on, and individuals and career coaches that have done this job for 20 or so years, and having them change the way that they do it. That was the hardest thing, was to get that across. But I think one of the things that helped was starting the process from the top down. So I'm working with my leadership team, and the leadership team is working with them, and ultimately them working with their career coaches. So everyone is on board. We can answer each other's questions and kind of have that peer-to-peer support that they needed.
Mm-hmm. Yep. Erin, anything you want to add to that?
Yeah, as you were talking, Gerard, I was remembering I had forgotten about that reaction of staff saying, like, wait, were we bad before? Or, like, did we have a horrible program before? And being mindful to myself of, like, how do we kind of bring people along, and how do we talk about this change in a way that honors where we've come from and what we've learned, and kind of, you know, the job that they were asked to do in the past. And that too, like, I would constantly remind people, like, look, we were all there. I was a case manager. It was like compliance 101 when I was a case manager. I mean, there was no room for really any creativity. It was pretty much like, here's your work requirement, go do it. I'll talk to you in a month, you know? So it was so different. And there are many people who have been along for that long as well. And so kind of helping people to get to that place of, like, we're not saying you did it wrong. We did it the best we could at that time, and now we know better. And I think that there's a Maya Angelou quote that I just love that is along those lines. I'm not going to get it just right, but it's something like, when you know better, do better. And that's really what it is. You know, it's like we're learning, we're growing together, and we know better now. So now we're going to do what we know is a better way of doing things. We also had a certain number of people who are kind of like, oh, we've always been doing it that way. This isn't really any different. And that's always kind of interesting, because then also sometimes the same people are saying, I can't, there's too much change. I can't do all of this change. And so it's very like interesting experimenting, kind of like human psychology and how we react to change, and bringing people along. I would say most people are on board, but really just continuing to reassure people we're all doing the best we can. We're all learning together, and also that we're not going to be punitive to them either. And so if you make a mistake, it's okay. I'm making mistakes too, you know, and we're just going to learn and grow together and continue to get better. So I think those are some of the things for us.
Yeah, absolutely. So it's a great day when I get to quote Simon Sinek and Maya Angelou in the same session. So the quote, friends, is actually do the best you can until you know better. Then when you know better, do better. Mostly we just hear the second half of that, right? When you know better, you do better. I think it's really, I see the 10-minute note. Thank you. And I see the comment, Rhonda, we're going to get to that 1 second. I think both of those are incredibly appropriate, typical, and valid psychological responses, right? We're either going to defend what we've done historically. We're going to do that in one of two ways, either by saying, but I did what you told me to do, or, but I'm already doing what you're asking me to do now. Like those are just how humans respond to things. And I think, Erin, you said something in your comments about give choice when choice is possible, right? And I think it's a really critical takeaway that not every choice is going to be possible for every participant or for every case manager or career coach, right? There was not an opportunity for folks to choose whether the program, whether Reach Up or Michigan Works in Saginaw, were going to move in this direction. That was happening, right? The choice is available to the workers, or the extent to which they wish to stay, right? You still have choice. You may choose to separate from the organization. That's always an option. You may choose to contribute to how the implementation happens, but you may not choose whether or not the implementation is happening. And so it's important that we don't, walk away from this session thinking that there are no structures, right? There's no expectations on participants. Certainly there are still parts of the program that are mandatory, but creating choice where choice is possible is the really, I think, critical takeaway about that. Okay, so the message in the chat says our staff feel like they are not using tax dollars appropriately. And I'm not sure if that means right now or if we were to do something in this sort of more modern human-centered space. Rhonda, I'm not sure if you want to clarify so we can reflect.
They just basically are like, our legislators would tell us we're not using our tax dollars appropriately, and it's a pushback is what it is. And we have said, you know what, you have the option, and this is not a right, wrong, good or bad. It is just what it is. This is the way we're moving. And we want you to treat customers with a great deal of respect and understanding and compassion, you know, and this is how we see doing that. But again, like I said, it's just a pushback thing. And I never really know how to answer that statement when they say, well, what about tax dollars? Because it's like, okay, I get it. I get it. It's our tax dollars, but it's not just your tax dollars. It's everybody's tax dollars. And this is the movement that we have talked about and we're moving forward with. So anyway, I don't know if anybody has any other comments that I could use to help them understand the whole tax dollar part of it.
I would be curious to ask, you know, dig a little deeper with that. And what exactly do you mean by that? You know, what do you see as, why do you see this as not a good use of tax dollars maybe, and kind of try to get at the root of what that, I mean, I can guess what some of the roots are for that, but to kind of tease that out and give the opportunity to have a conversation about that. I think to a degree, you know, the evidence can help bring people along of kind of showing people, well, this is how this works, and looking at some of the historic nature of TANF and how it worked, and how was that a good use of tax dollars in helping people truly, you know, move on to have sustainable jobs. And I think, you know, the research is pretty clear in a lot of ways that the strong push for employment first at all costs and not considering, you know, training and career ladders, and people come back to TANF. And so that's not a sustainable future for families, and it's not a healthy economy. And so, you know, I don't know if some of that would help. I think to a degree, there are a certain number of people who have dug in their heels, and it doesn't matter what research, what evidence you produce, what, you know, kind of what conversation has had, it's going to be at a point where it's like you said, like, well, the choice that you have is that if you can't get on board with this, there are lots of other jobs out there that might be a better fit.
Yes.
Let me make a comment.
Yeah.
It's
Steve.
Also, I mean, I think you could research, there's research been done on people who are more productive for the economy when they get employment and they maintain employment, they have higher earnings, they start paying income tax and stuff. I think you're getting the money back, you know, eventually, that you put into helping them. So I mean, I'm sure there's studies that have been done, general studies have been done related to that, that'll show you you're not just throwing the money away, at least on average for those people. So
I like that, Steve. Thank you. And I like, Aaron, what you said too. And I wrote those things down. So thank you very much. I appreciate that.
One thing, let me make a comment. In our state, well, I won't go back in all the details, but we had a very conservative governor prior to the one that we had now. And they pushed our agency to, they limited our TANF lifetime to 24 months, but also they pushed to show data to show that how many
Good afternoon. My name is Caprisa Randolph Robinson, and I'm the program specialist in Region 5. Welcome to State TANF Essentials. Today, I'm going to be presenting with two of my colleagues in Region 8. I'll go ahead and let them introduce themselves.
Hello, everyone. My name is Janelle Jones. I'm a program specialist in the Region 8 office out of Denver, Colorado.
Hi, everyone. Good morning. I'm Marjorie Hudspeth, and I'm also out of the Denver Regional Office, and I work with state TANF and tribal TANF programs.
Okay, next slide. Next slide. So let's go ahead and review the agenda that we're going to be reviewing over the next 70 minutes. I'm going to be reviewing the organizational overview along with the TANF historical background, context, and purposes. Janelle's going to review the TANF key requirements, which is the program and fiscal, along with the TANF work requirements. And then she'll end it with going over some of the things in the required TANF plans. And then Marjorie will go over general TANF program and reporting requirements and end it with some resources and partners. Again, if you guys have any questions, you're more than welcome to put them in the chat, but there will be places along the way that we'll pause for any questions or anything. And I'm gonna go ahead and apologize ahead of time. I had 3 cups of coffee, so if I'm a little hyper, I'm gonna slow down. So we're gonna get into the organizational overview. Could you move to the next slide? So this is a visual representation of how ACF is organized. The Office of Family Assistance is one of the number of offices under ACF. Move to the next slide. OFA is comprised of different divisions. This image shows the divisions that work together to administer federal grant programs that foster family, economic security, and stability. So in this chart, you primarily work with the regional offices. If we have any data folks on the line, they work with the Division of Data Collection and Analysis, where they submit monthly feedback files, work participation rate information. So the region collaborates with the states and the tribes, as well as other divisions listed within this chart, along with any other ACF partners to assist in the administration of OFA grants. Next slide. Where do we work? So there are 10 ACF regional offices. This graphic shows the states and territories which compose each region. ACF also has a central office that operates right out of Washington, DC. And this particular region meeting that's happening over this week actually covers Region 5, which the region office is in Chicago, Region 6, that office is in Dallas, Region 7, that office is in Kansas City, and Region 8, that office is in Denver. Next slide. OFA regional offices support a total of 207 programs. So when that's broken out, you have 50 states, DC, and 3 territories implementing the state TANF. You have about 75 tribal TANF programs, and those are federally recognized tribes and Alaskan Native organizations. And then we also have 78 new grantees, and new stands for Native Employment Works. And they provide work-related activities that support job readiness and job placement to Native Americans. Next slide. So now we're going to switch gears and discuss some background of the TANF program. Next slide. And looking at the legislative history, beginning in 1935, we had Aid to Dependent Children, ADC, we changed to AFDC, Aids to Family with Dependent Children. Then we went into 1996 under Welfare Reform Act, PRORA, Personal Responsibility and Work Opportunity Reconciliation Act. Under this act, there were some key pieces of legislation. They replaced the federal state match under AFDC with the state maintenance of effort requirement under the TANF block grant. It included new work requirements. It also established a 5-year time limit for families. It also authorized federal recognized tribes to run their own TANF programs. And then there was permitted spending on assistance authorized under prior law under AFDC within limitations. Then we moved to DRA, Deficit Reduction Act, and that was in 2005. Key pieces of that legislation was a recalibrated base year for the caseload reduction credit from 95 to 2005. It added families back into the separate state. It added families in separate state programs, into the work rate calculations. HHS actually defined the TANF statutory work activities and work eligible individuals. And then last, we require states to develop a work verification plan. Moving to 2009, ARA, which stands for American Recovery and Reinvestment Act. So some key pieces in this legislation, it established TANF Emergency Contingency Fund to provide funds to jurisdictions that increase spending on basic assistance, non-recurrent short-term benefits, and subsidized employment. It also lifted restriction that unspent federal TANF funds reserved or carryover into succeeding fiscal year could only be spent on assistance. Next slide. So these are our TANF laws and regulations. So federal laws, they set the minimum rules. States can enforce more stringent rules. For example, federal limit for assistance using TANF funds is 60 months. However, in some states, they have a shorter limit, such as 48 months or even shorter than that. There are no two states that have programs that look the same, which allows states to develop programs that meet the needs of the populations they serve. And Janelle or Marjorie, if you all could post those links in the chat if you already have it. And one thing that I would like to suggest, if you don't already have it, you can save these to your favorites so that anytime you want to look back and you have questions, you can always go there. And of course, reaching out to your designated program specialist. Next slide. So OFA issues guidance documents to clarify those TANF laws and regulations we were just looking at on the previous slide. And we do that through program instructions, which provide instructions on implementing regulations. We also do that through informational memorandums, which we call IMs. And this is just a means for communicating with grantees or potential grantees on a variety of matters, such as program activities, priorities, progress reports, research findings, any proposed pending federal legislation impacting human service programs. IMs can also provide tools or models or techniques that may be used for program development. We also use policy announcements, and those provide guidance or clarifications on policy, clarifying any common state questions. And then we have the Q&A documents. And these answer commonly asked questions on policy, procedural, or programmatic matters. Janelle or Marjorie, if one of you all could copy and paste the link right there, and you'll have access to the program instructions and the things that are discussed in this slide. Next. TANF allowable uses and expenditures support needy and other eligible families through assistance and other services and activities that support the four purposes of TANF. The chart above indicates which service supports are tied to which TANF purposes. In later slides, we'll discuss in a little bit more detail what supports and activities makes up assistance. But please note, rules regarding who may receive assistance under TANF are more narrow than rules for other services or benefits. For example, services under 3 or 4. Many provisions, including federal time limits, work participation rates, and data collection requirements, only applies to those families receiving assistance. Next slide. So these are our 4 purposes of TANF. And we're going to dig a little deeper in the next slides. Purpose 1 and 2 targets needy families. 3 and 4, needy families and other eligible families. To qualify for TANF, a family typically needs to have income well below the poverty line, about $1,800 per month for a family of 3, but for every 100 families in poverty, just 21 receive TANF cash assistance, about 0.6% of the population. Could you go to the next slide, please? So purpose 1, which says provide assistance to needy families so that children may be cared for in their own homes or in the homes of relatives. So state use TANF grants to fund cash assistance payments to low-income families with children, as well as a wide range of services that are designed to address one or more of the program's 4 broad purposes. Only needy families or low-income families with children as determined by program requirements can receive assistance such as cash payments, vouchers, and other forms of benefits to meet the family's ongoing basic needs. Assistance is tied to time limits and work requirements as defined by each program. Supportive services such as childcare and transportation provided to those families who are not employed are considered assistance. But childcare and transportation for families who are employed do not count as assistance. Non-recurrent short-term benefits and work subsidies are limited to needy families, but are not considered assistance. So assistance-related limitations do not apply. Both needy and other eligible families can receive services that do not fit the definition of assistance, such as counseling and family support services. Next slide. Purpose 2. Purpose 2 is to end the dependence of needy parents on government benefits by promoting job preparation, work, and marriage. The key things to know about Purpose 2, the same as Purpose 1, it serves needy parents, needy individuals. Things to know: the state determines eligibility standards just as Purpose 1, which are usually going to be defined in your plan. The activities under Purpose 2 promote and support job preparation, work, and marriage. So these are going to be your employment and training activities, or job or career advancement activities, marriage counseling, financial support for childcare services. These are also employment services, including those that can increase the non-custodial parent's ability to pay child support. Next slide. Purpose 3. Purpose 3 is to prevent and reduce the incidence of out-of-wedlock pregnancies. Now, under Purpose 3 and Purpose 4, it can serve the needy, just as Purpose only 1 and 2 did, or it can serve eligible families, or it can serve both. But what's important is that, however, the program must establish and implement objective criteria to qualify for the program, which is done in your plan. Under Purpose 3 and 4, sometimes these activities can get a little bit more scrutiny. So some key points to remember when you're designing your programs that is clear. If it's not clear on the face of the activity in the plan, you want to clearly explain how the activity and the intended results of the activity accomplishes the calculated purpose. So for example, sex education programs, teen pregnancy prevention activities, those are pretty clear. It links back to the purpose of this purpose just by reading it. So again, if it's not clearly defined on the face of the activity, you want to make sure you clearly describe that as a part of your in your plan for the activity. Let's go to the next slide. Purpose 4. Purpose 4 is the formation and maintenance of two-parent families. So again, under Purpose 4, it can serve the needy families and eligible families. But again, programs must establish and implement objective criteria to qualify for this program, which is usually going to be in your plan. The activity, again, must clearly link back to the purposes. So some of the examples that are clear activities that link back to this purpose are healthy relationship classes, couples communication classes, premarital counseling, initiatives to promote responsible fatherhood, parenting skill trainings. So if the activities do not clearly link back to that purpose, you need to make sure that you're very descriptive to show how the activity is reasonably accomplishing this purpose in your plan. Next slide. Time limits. Some key points under time limits. Under Parole, it set a federal time limit of 60 months for a family that includes an adult recipient receiving federally funded assistance. Under the hardship exemption, states can exceed the 60-month limit for up to 20% of their caseload based on hardships. Federal law does not impose a time limit on child-only families or on families receiving assistance funded entirely with state MOE funds. And then the last thing, this is some guidance on how to count time limits. It is available here. And if Janelle or Marjorie, if you guys could also add that link into the chat as well. Next slide. Did you know that almost half the states, 23 to be exact, have adopted a time limit shorter than 60 months? Did you know the 60-month federal time limit applies to the average monthly caseload? Did you know that states may choose to fund cases in a segregated state program or a separate state program if cases are nearing the 60-month time limit, or the state is beyond the 20% of cases under the hardship exemption? Did you know that most states are nowhere near reaching the 20% hardship exemption threshold? Next slide. Do we have any questions at this point? And I'm just checking to see if we had any questions in the chat. I don't see any questions in the chat. And we always have room for questions. So there will be several times along the way that you all could ask any questions or even at the end. I'm going to go ahead and hand it off to my colleague, Janelle.
Good afternoon, everyone. I'll be starting this section with TANF key requirements, which covers the TANF program and physical portions. Next slide, please. So, TANF block grant. The TANF block grant provided to the states is fixed at $16.57 billion annually. The TANF amount available for each state was set based on its spending under the pre-1996 AFDC, Emergency Assistance and Job Opportunities and Basic Skills Training Program, which you might also know it as being referred to as JOBS. This was formulated using a formula based on peak expenditures during the fiscal year 1992 through fiscal year 1995. Each state's grant is known as a State Family Assistance Grant, also referred to as the SFAC. Maintenance of effort. MOE is a requirement of state spending on TANF or TANF-related activities. The MOE represents a percentage of a state's fiscal year 1994 contribution to AFDC, emergency assistance, jobs, and AFDC-related childcare. States must expend in MOE 80% of the amount spent in fiscal year 1994 in its formal AFDC-related programs. This percentage decreases to 75% if the state meets its work participation requirements for that fiscal year. TANF Contingency Fund. The 1996 Welfare Reform Law established a $2 billion TANF Contingency Fund due to concerns that TANF funding might be inadequate during economic downturns. To draw upon contingency funds, a state must meet these three criteria. They must first meet a test of economic need. Second, meet 100% contingency fund MOE requirements, and also match at the Medicaid rate above the threshold. Contingency funds are only available to the 50 states and District of Columbia. Tribes and territories are ineligible for contingency fund grants. Next slide, please. Transferring TANF funds. There are a few points to remember when considering transferring funds. Funds transferred from TANF to Social Security block grant are to be used only for programs or services to children or their families whose income is less than 200% of the income poverty guideline level applicable to a family of the size involved. This is defined and revised annually by the Office of Management and Budget. Rules of the receiving program apply once funds are transferred. Only current block grant fiscal years must be transferred. No carryover reserve funds can be transferred. Next slide, please. Defining MOE. If a state fails to meet the required minimum all-family or two-parent work participation rate for a fiscal year, then the state must spend at least 80% of its fiscal year 1994 historic state expenditures in that fiscal year. And some additional links that are posted on this slide will be also posted in the chat as well for your reference. Next slide, please. State-funded programs. State program maintenance of effort. There's three state-funded programs. There's the state program maintenance of effort, MOE TANF. There's also the separate state program maintenance of effort, SSP TANF. And then the last one is the solely state-funded program, which is not TANF. Not all states have these funded programs. You can kind of read over some of the requirements in the rules to for these funds, but these are the three state funded programs. Unobligated balances. There is a wide variation across states, with some having no unobligated balances and some with balances exceeding their entire block grant. The flexibilities within TANF allow states to set aside or save funds for unexpected occurrences, which might increase costs or demand for basic assistance, such as natural disasters, public health emergencies, or recessions. In recent years, the total unobligated balance across jurisdictions increased from 1.5 billion in fiscal year 2013 to 5.2 billion. Regarding prior approval, TANF programs can seek prior written approval for indirect or unusual costs, such as equipment or acquisition costs. This is required for purchases of equipment or software costing $5,000 or more. Without prior approval, only the depreciation value can be charged annually. Next slide, please. So now I'll give an overview of TANF work requirements. Work participation rates. By statute, the required work participation rate is 50%, and for two-parent caseloads, 90%, minus caseload reduction credit if the state is eligible. Overall work requirements. States must engage at least 50% of TANF families with their work-eligible individuals. Families must be engaged in a federal work activity. 30 hours must be in at least one or more of the core activities. The requirement for single parents with a child under 6 years of age is an average of 20 hours per week in one of the core activities. And for two-parent requirements, states must engage at least 90% of TANF families with two parents who are work-eligible individuals, also with one or more of the core activities. Therefore, the two parents must average at least 30 hours per week, since their work participation rate is 90% more than the 50, clearly. The hourly requirements are raised 55 and 50 hours respectively if the family receives federally subsidized childcare. Also, two-parent families are included in both the overall requirement and also the two-parent rate. Next slide, please. Statutory work activities. Core activities and non-core activities, as I mentioned before, which families must engage in. Here are some of the listed ones. As you can see, core activities count towards the first 20 hours. Unsubsidized and subsidized employments are a couple of those eligible activities. All of the non-core activities consist of job skills, training directly related to employment, education directly related to employment, and attendance at a secondary school or a GED program. Hourly requirements. Hour requirements for work activities vary by family type. The hourly requirements are divided by core and non-core for all but the single parent with a child under the age of 6, which only has core hour requirements. In a two-parent family, if one of the parents qualifies for SSI or SSDI based on their disability, the person would not be a work-eligible individual. So the two-parent rate would not apply to them. This reference here is only for someone who the state defines as disabled. Next slide, please. Work-eligible individual. A work-eligible individual is an adult receiving assistance or a non-recipient parent unless the parent is a minor parent and not the head of household, a non-citizen who is ineligible to receive assistance due to his or her immigration status, a recipient of SSI or SSDI, a parent providing care for a disabled family member in the home, or an individual in a family receiving MOE-funded assistance under an approved tribal TANF plan. Next slide, please. Here's some examples of who is excluded from the work participation rate. Not every household or participant is included in that calculation. And as you can see on this slide, here are the exceptions. Child-only families, families who are sanctioned, a parent providing care for a disabled family member, and some other examples. Next slide, please. Sorry, I just had a little bit of technical difficulties. So good cause appeals in an individual sanctions. Recipients with few exceptions must work as soon as they are job ready or face possible sanction or termination of benefits. States have autonomy to decide what form sanctions they will take. Sanctions may be individual or full family, partial or full reduction in cash benefits, and can be temporary or permanent. About a dozen states use a percentage reduction approach for the initial sanction for non-compliance with work activities. The other common approach are removing the adult's needs. This is the AFDC sanction policy that some states still use. It is important to note that even if a family or individual has good cause and is not sanctioned, the family remains in the work-related calculation. Section 402, the document shall set forth objective criteria for the delivery of benefits and the determination of eligibility and for fair and equitable treatment, including an explanation of how the state will provide opportunities for recipients who have been adversely affected, and they can be heard and they have to be heard in the state administrative or appeals process. This section right here also is required to be in your state plan, which will be addressed later. Next slide, please. Failing to meet work participation rate. If a penalty was not imposed on the state for the immediate preceding fiscal year, then the penalty is up to 5% of their SFAG. The state must also match 80% for MOE for the succeeding year. If a penalty was imposed on the state for the immediate preceding fiscal year, for each consecutive year, the base penalty amount will be increased by 2%. This is added to the existing penalty up to 21% of the adjusted SFAG. If we find that we determine the penalty erroneously or the state has adequately demonstrated that it had reasonable cause for meeting their work participation rate, the penalty will not be imposed. Next slide, please. Caseload reduction credit. Caseload reduction credits can move a state's work participation rate targets. Since TANF inception, about 15 to 30 states have had a 0% target for their overall work rate each year. The caseload reduction credit reduces the state's required participation rate target by 1 percentage point for each percentage point that the state's assistant caseload for the prior year. States and territories complete a caseload reduction credit and report annually, which is ACF 202. You can see this report for additional instructions, and we can post that in the chat as well. And we'll pause now for questions, which is the next slide. And you can ask to be unmuted or post any questions you have in the chat. Is there anything that has came through for Prisca and Marjorie?
I don't see any questions in the chat yet.
Okay.
Yeah.
Okay, well then we will move right along to TANF state plan. Thank you. The TANF state plan outlines the state's implementation of the Title IV-A TANF block grant. Each state develops its own TANF state plan, which describes how it will support the 4 purposes that was mentioned earlier of TANF and ensure program compliance. And you can read over here some information, and Marjorie also posted the link in the chat. Next slide, please. Did you know there's a new state TANF certification requirement? The Consolidated Appropriations Act 2022 added a new TANF certification related to providing information to victims of sexual harassment or survivors of domestic violence, sexual assault, or stalking. States have 1 year from the date of enactment, which will be March 15, 2023, to implement in an amendment of their state plan or in their state plan. So if you have a state plan up for renewal before this date, you could just simply revise it and add that in. Or if you do not have a state plan coming up before that date, you will need to send an amendment to your appropriate regional office. You can visit the link that's posted in the chat for additional information. Next slide, please. TANF state plan renewal. TANF plans are required to be renewed every 27 months. In other words, we look back 2 years prior to the start of a fiscal year to see if the state has submitted a completed plan. It has until the end of the first quarter of the current fiscal year to do so. For more information, we'll post a link in the chat as well. I think most people kind of, know how the state plan renewal works. It's a little tricky, like, yes, it's 27 months, but it still is determined on like how the fiscal year falls of when the state plan is renewed. And I've also worked with a state who's aligned their state plan up with legislation and so forth. So that's always an option if like the state plan renewal date doesn't work for you and you kind of like want to align it with something more appropriate in your state. That's always an option as well. Next slide, please. WIOA combined state plan. TANF and WIOA programs may have different planning cycles. If a state includes TANF in its WIOA combined plan and the TANF program has a different planning cycle from WIOA, a state should submit program-specific changes to meet the planning cycle for that program. A state can align with WIOA by having ACF consider the submission to be a plan renewal. So if you have questions about that, we'll post more information in the chat for the link. With the link. Next slide, please. So the work verification plan, thank you. Work verification plans lay out state's TANF work program, including countable work activities, how the state will monitor and verify participation in work activities, how the state will comply with time limits on certain activities, and how the state will determine who is work eligible. The linked work verification plan guide provides helpful information on requirements and submission methods of the work verification plan, which we can post in the chat, but most states submit one work verification plan, and unless there's major changes, as I mentioned before, that's the only reason why a work verification plan would need to be revised. So it's very seldom that it needs to be revised. So usually they stay intact for for as long as the program is in good standing. So unless like sometimes maybe if you have like a system change in your state, like you change systems and that may change a lot of stuff in the state, then that would need to be changed, but not so much of like just simple wording or so forth that a state would need to revise their work verification plan. Next slide, please. And so now I will turn the presentation over to Marjorie. Thank you.
Thanks, Janelle. Does anyone have any questions? I'll just pause here for a second because there was a lot of content that we've covered. You can post it in the chat or unmute yourself. Just please at any time feel free to chime in and speak up. Okay, I don't see anything, so I'll continue. So I'll talk about the general TANF reporting requirements. EVES stands for Income Eligibility Verification System. States are required to maintain and use an EVES system, and some states call it VENDEX or BEERS, which is Beneficiary Earnings Exchange Record. They provide the same earnings data to states, but EVES is a requirement that applies to any applicant or recipient receiving TANF benefits as long as it is required that they meet income or citizenship eligibility. Next slide. This slide outlines the financial reporting requirements for TANF. You'll see that the federal fiscal years are in the inside of the circle and the due dates are on the outside. States are required to submit these reports electronically through OLDC. Recently, OFA issued an updated program instruction this year. It was on May 25th of 2022, and it revised the instructions for the 196. I have the copy, or I think I do. Hang on one second. I'm going to post it to the chat because the one that's in the slide is not quite right. Let's see. Okay. But this PI that was just recently issued, it made several updates to the instructions on the form. And one thing is that as of federal fiscal year 2022, that expenditures are reported in exact amounts rather than being rounded now. It removed an outdated column for ARA funds, which was from a long time ago. And then it also made revisions to the instructions. It added examples and references that are embedded into the report. And it's really very helpful because you can now hover over some of the lines in the report and it will give you examples, definitions, where to look up more information. So it's a good thing to have whether you're working on the program side or financial side. Next slide. So some of the common problems we see with the 196 report are on the slide here. A lot of them are from not providing enough information. So I guess the tip here is that there's never too much information that you can provide on these reports. For those that aren't familiar with the report, there's two parts of the 196. Part one is the financial data that where the expenditures are reported by line item, and that's reported quarterly. And then part two is the narrative report. And that's where the language where you probably need to provide more information on, but you would report expenditures that are authorized solely under prior law or in the other category. And the narrative report is due annually. I'll mention the fourth bullet here on this slide, the misalignment between basic assistance spending on the 196 compared to the data reports. Our team that works with TANF data also reviews the 196 reports to ensure that the data reported here is similar or it matches to the caseload data that's reported on the 199s and 209s. That's the quarterly TANF data reports. Another example of a misalignment is MOE amounts. So the MOE figures on the fourth quarter 196, the total, needs to match the state's 204, which is their MOE report. We'll talk more about that in a minute, but those numbers also need to match. Okay, next slide. Okay, so the TANF annual report, it's also called the 204. Sometimes we call it the MOE report. It's the annual report of TANF programs and state MOE expenditures. They're submitted annually. They're due in mid-November, but we always give states until the end of the year, so December 31st, to submit their report. Anytime you want to submit it is fine, but we do allow for this extra time to be sure that the reports are comprehensive and complete. And we recommend that the state program and fiscal staff work together to complete the 204, since it does also encompass some of the figures from the 196 reports. So what's reported through MOE, the total MOE on the 204 report needs to meet the total MOE reported on the 196 report. One other thing is that if revisions are made to the 196 report, then the state also needs, well, let me back up. If the state makes changes to the MOE figures on that 196 report, then they'll also need to revise their 204 report so that the MOE figures match. Okay, next slide. Okay, the caseload reduction credit report. Janelle discussed earlier the caseload reduction credit. It's a way that states can lower their target work participation rate by demonstrating a decline in caseload or if the state has spent excess MOE. So the caseload reduction credit report is the tool to capture this information and to calculate if the state is allowed to take a credit for that. This is an optional report. Not every state chooses to do this. If you do request a caseload reduction credit, you have to do so by the end of that year. The state can't request it after December 31st due date. And if you're interested and haven't done that before, then be sure to talk to your regional office and they can make sure you have all the correct forms and walk you through the instructions. Okay, next slide. Okay, so this is the data reporting where states and territories are required to provide information on all families receiving TANF and also on the closed TANF cases. The data collected here is not only used to calculate work participation rates, but also they use the data to publish information on state TANF programs, including caseload data, how TANF money is spent, and the characteristics and financial circumstances of TANF recipients. In yesterday's presentation, somebody had asked about that. I'll go ahead and put the latest report into the chat. Oh, where's the chat? Hang on 1 second here. So this gives a lot of information. If you're ever wondering about what other states are doing, how they're spending their money, what kind of programs they have, you can look up states that are similar in size to you or urban, rural, areas. You can really, there's a lot of information on those reports. So I would recommend taking a look at those. Okay, next slide. So next, we'll just talk about resources and partners. OFA, Peer TA, there is a lot of text on this slide, but we just couldn't leave anything off because there's so much that Peer TA does. So Peer TA is an excellent resource for anyone looking for information about training and technical assistance offered by OFA. It has articles and reports on research. There's copies, recordings of past trainings and conferences. You can connect with other states and tribal programs to ask questions or share information. There's a lot of stuff on there. There's a learning center too, where you can access free training materials such as the Career Pathways Toolkit and Coaching for Success learning modules. You can subscribe to the newsletter through Peer TA, and when you do that, you get alerted for upcoming trainings or webinars. So it's a good thing to do. You would just go to, I'm not sure if the link, Janelle, can you post the link? I think the link's on there. When you go to Peer TA, you're welcome just to look around, but if you do decide to join, you just click on newsletter at the top and you enter your information. You can join the newsletter that way. Okay, next slide. So this is again about the Peer TA. We just wanted to make sure to highlight that in the Learning Center is the Coaching for Success training. It's a 14-module online curriculum that can be used with employment case managers or supervisors and learning how to leverage coaching techniques into the case management practices. It's self-paced and it covers topics like active listening, how to ask powerful questions, emotional intelligence, for example. And all of it is free. So we wanted to make sure you knew about this opportunity. Okay, next slide. All right, and this slide just lists some other helpful partners that we work alongside with. The Office of Grants Management, Congressional Research Service has several useful reports. It has things such as TANF legislative history. It has information about proposed TANF reauthorization bills. So that's a good thing to check out. And then the Electronic Code of Federal Regulations. Janelle, if you could just put that link in the chat. This is always the best link to use to look up regulations because it's updated continuously. You'll never run into an outdated version of it. So keep this link in your favorites for when you need to look up regulations. Okay, next slide. And that's it. It's time for Q&A. Let's see. I see in the, oh, okay. So thank you. Yes, the presentation, we just need to make a couple more little tweaks to it. We want to make sure it has all the correct links and everything in it before we send it out to you all. So as soon as that's ready, we'll send that out. Is there any questions on anything that we've presented so far?
We have a little extra time. I'm curious to know, is there any staff that's new to the state government and working with TANF? And I'm just wondering like if this presentation was of assistance to you. Did you learn anything new or so forth? I know some states have high turnover and a lot of people aren't able to retain the information to pass it on. So just curious if you all have any questions.
Yeah, and even if you aren't new, do you think it would be useful for new staff when you got them? Great, thanks, Paulette. Is there anything, I mean, we have, what we presented today is kind of part of a larger presentation. We do have some additional slides that we just didn't include today because it goes into a little more detail than time allowed. But is there anything that we didn't cover that you would have liked to see? And there's no hurt feelings here, so say whatever you want.
I'll have some extra time before the next session, I believe.
Yeah, we might.
Yeah. After this, am I correct? We go straight to break and then back to another session?
Yeah, and then the next, I have to pull up again. When does the session begin? Session will begin after our break at, it's 11:45 Mountain Time, 12:45 Central, and 1:45 Eastern. So that's when we'll begin our peer-to-peer sessions.
So they have the opportunity to join another session if they want?
Absolutely. If they hover on the bottom, they should have an icon that says breakout rooms. And when you click on that, the menu will pop up. And then if you want to go to one of the other sessions, you can just hit the join button.
Okay. Well, thank you everyone for joining us today, and I hope it was helpful.
I want to welcome you to this session on our new normal, which is around sort of this shift to the virtual world and now sort of in a hybrid world, and the impact that that has on TANF customers and agencies. So today you will hear about opportunities and obstacles to providing both virtual and in-person services, what efficiently balancing those services look like, and what resources are available to help empower service delivery agencies to navigate this new hybrid world. My name is Kristen Abner. I am a Director of Poverty Solutions here at ICF. My role focuses on the interaction between research and policy and practice. So you'll hear a lot of those themes throughout these presentations. So I had the privilege of hearing these presentations yesterday, and you'll hear a lot about uplifting customer and staff voice, active listening, and sort of that interaction between in-person and virtual and hybrid. So you're in for a real treat today. So I'm going to start by introducing our first speaker, and then I'll introduce our other two speakers in between the presentations. So first, we have a presentation that will provide strategies on service delivery in a changing landscape from Amanda Briggs. She is a senior research associate on the workforce development team at the Urban Institute. And her research focuses on the impact of technology on learning and the evaluation of workforce development and post-secondary education programs. Briggs is the Deputy Director for the Center for the Career and Technical Education CoLab Coalition and College Community of Practice program that's led by the Urban Institute. The program involves collaborating with 5 national partner organizations to convene and support a community of practice of 12 community and technical colleges working to develop a toolbox of evidence-informed resources to close racial equity gaps in online programs. She holds a master's degree in public affairs and social and economic policy from the Lyndon B. Johnson School of Public Affairs at the University of Texas at Austin. So Amanda, I'm going to turn the mic over to you.
Thanks so much, Kristen. I'm really excited to be with you all today and to participate in both sessions today and yesterday. As Kristen mentioned, I think you'll find a lot of similarities across our different presentations. I'm going to be talking today about strategies for practitioners in a changing service delivery landscape. And just by way of quick background, the Urban Institute is a nonprofit, nonpartisan research organization with experts across many different issue areas. And my particular area of research focus is in workforce development and higher education, looking at programs that serve young adults all the way to older workers to understand which strategies help students or participants achieve success. And I say that because today I'm going to be sharing insights across some of our recent projects that are focused on understanding the impact of technology on learning. And I'll be pulling from the workforce and education context, but I think there are a lot of transferable lessons for social service practitioners who are grappling with how technology improves access or presents barriers to critical safety net benefits and services. And one of the key similarities across different service contexts, of course, is having to move many services online. Next slide, please. So just as some context, we know that the past few years of the pandemic has presented so many challenges for program participants and all of you, the staff and organizations that support them, as everyone has had to adapt to this new normal of remote service delivery, given the unique circumstances of the health emergency. And the pandemic has also disproportionately impacted groups that for structural reasons have been historically excluded from opportunity, leading to additional challenges with technology use. Families and individuals with low incomes, BIPOC individuals, people with disabilities, and other historically excluded groups are more likely to face barriers to success in remote learning due to structural inequities. And these barriers include a lack of technology, lower digital skill levels, challenging home learning environments, and material hardship. But at the same time, there are opportunities that remote service delivery presents as well, including that expanding access to technology-mediated services can create flexibility in service delivery that may work better for individuals juggling the demands of work activities, childcare responsibilities, and the pursuit of additional education and training. The increased use of technology and desire for flexible options requires adequate supports for participants and staff to reap the benefits, even as part of a hybrid approach. And there's a reason to believe that hybrid opportunities for service delivery, where services are delivered part online and part in person, are here to stay. Next slide, please. So this figure shows the results of a survey of college administrators our team conducted of community and technical colleges in our partner network to gather timely insights into their approaches to online learning. Respondents were asked to reflect on their college's modes of program delivery during 3 periods: fall 2019, before the pandemic, fall 2020, during the pandemic, and fall 2021. And we fielded this survey in 2020 when we thought that the pandemic might end before the fall 2021 semester. So we asked people to assume that the pandemic would be over by fall 2021, which of course we now know is wishful thinking. But you can see that for nearly every program, college administrators estimated a smaller return to in-person learning than before the pandemic. And I wanted to put this into the slides just as an example to show from one sector that the pandemic has already accelerated trends that were underway previously. We know in higher education that things were shifting online before the pandemic, and we do expect this shift to continue. So regardless of whether your organization is exploring hybrid or fully virtual service delivery in some aspects, I think there are some key lessons for using technology and service delivery that can be taken away. Next slide. So the key principles that are on this slide are drawn from interviews and the voices of practitioners providing remote services both to youth and older adults through services provided by community-based and education and training institutions. So I pulled this slide together, pulling heavily from a project that we did focused on strategies for serving youth, but also pulled some additional insights from other work that we've done talking with practitioners in the higher education context and also with organizations that serve older workers as well. And so what I'm lifting up here is really reflections that we heard from practitioners themselves in our research about how each of these different dimensions were key to best practices for using technology and service delivery. So the first one here is creating the foundation for success or meeting participants' basic needs first. This requires access to reliable technology, basic digital skills, and home environments conducive to physical safety and food and shelter. All of those things have to come first before you can expect people to be able to benefit from digital skills and technology. So we just have to make sure that there are opportunities for Wi-Fi access and basic needs assistance as a foundation for providing technology as part of your service delivery. And we heard yesterday, and you'll hear in the upcoming presentations about some braided funding that's been leveraged by some of our speakers to support things like sustained access to technology and ways that their organizations are working to build those foundational steps for success with using technology, including access to that technology. So making sure you have those resources available for your participants is key before they can benefit from them. And then the second key principle is strengthening organizational and staff capacity to meet new demands. We heard from so many practitioners that staff need space to engage with participants in new ways and need time to be able to work out what their new normal looks like. And so finding ways to provide opportunities for peer learning and professional development, but also just ways that maybe you can adapt scheduling with your staff or ways for people to take breaks and just decompress a bit in between all of the various demands on their time. And we heard was critical to be able to give people a break and disconnect and take care of themselves while also managing this new pivot to increasing some staff responsibilities around the use of technology and just making sure people feel supported as they engage with participants remotely. The third key principle is around providing services that support mental and emotional health. We know the pandemic has been really tough on everyone's mental and emotional well-being, and it's also made some of those services more accessible. So an important tip if you're looking to connect people with mental and emotional health supports remotely is to consider which online tools enable virtual meetings while still protecting participant privacy. And when needs rise to the level of intervention in times of crisis, of course, those services have to be adapted and maybe an area where service delivery needs to shift fully to in-person. Fourth, building community. It can be really hard on both staff and participants to engage remotely. We're all familiar here with Zoom fatigue and those challenges of being on calls all day. And so some promising practices might include engaging in intentional and active communication through individual phone conversations and checking in with participants and organizing team building activities that break up larger cohorts into subgroups. Just finding ways to make the virtual space fun through creative celebration and events can help to break up some of the Zoom fatigue issues and all day engagement online. Fifth, ensuring content and delivery is engaging. Trying to find ways to identify your participants' unique learning styles is really important. And also just what style works for them best. So some people may gravitate toward a preference for in-person delivery. Some people may want a blended approach or hybrid, combining in-person and online. And some people might love to be supported through case management fully online. And so trying to find ways to hear from your participants that you're serving and making sure that you're identifying options that work best for those that you work with is a key part of making sure that content is engaging and that you're delivering it in a way that works for them. And I know that can be very complicated and challenging given everyone's different preferences. But when you can involve participants in decision-making processes about absorbing content in ways that works for them, it's more likely to be successful. And then 6th, selecting technology with a purpose in mind. So this final practice I'll touch on today is just to make sure that technology isn't the tail wagging the dog. In other words, making sure that the need that you're trying to address drives the technology that's selected rather than the other way around. You want to make sure that technology eases, not increases burden, and can supplement resources already provided to participants in person. Next slide, please. So thinking about all of these different principles that I just touched on, I won't spend too long on this slide so that we can get to our state panelists and learn more about the innovative things that they're doing in their states as they work to adapt to their new normal and service delivery. But I'll quickly lift up some key considerations and supports that came out from our research when using technology to provide services remotely. And some of these will touch on concepts that I just mentioned, but I thought it was important to kind of summarize before moving forward. So those key considerations include making sure that services are equity centered and prioritize the basic needs of participants. So that involves both taking care of foundational needs, food assistance, shelter, childcare issues and responsibilities before adding on that additional remote service capability to make sure that people's basic needs are met, but also trying to prioritize equity-centered services as well that are grounded in the desires of participants. And you might survey your participants, field focus groups, or do one-on-one interviews to understand what best works for them. Second is programming shaped around and by participants' needs and interests. So that ties in tightly to the first one, but just making sure that you're providing programming in a way that's engaging for participants and also not increasing staff burden to an extent that it's taking away too much from other responsibilities or things are feeling a little bit overwhelming. So I think there's just a delicate balance there, and we'll continue to talk about this probably in the discussion as well. And then the third is different content delivery approaches to reap benefits of virtual and in-person services. So as I mentioned, there might be different innovative ways that you want to engage with different participants based on their interests and the ways that they learn best. And then in terms of supports needed, digital skills training and technology access for participants is foundational for success, making sure that if your organization doesn't provide those services, perhaps a partner organization like a workforce agency or another partner in the community that can provide skills training might be available to help participants skill up and be able to access that technology and use it effectively. Second is establishing and leveraging partnerships that enable flexible service delivery. That could include working with a public library or another organization in your area that could help participants get online, for example. Third, staff development and training in online modalities and service delivery. Again, we know that these changes don't come without huge implications for staff. So just finding ways to make that development and training available for staff, but also engaging and fun whenever possible. We know it's hard to juggle all of these things at one time. Of course, accessible and affordable broadband, internet, and computer access are extremely important. And so again, finding those ways to work with partners in your community that might be able to help people get online if those funds or technology access points aren't available currently. And then considering ways that you can connect participants with other public services they may need through digital tools. TANF recipients might be receiving other public benefits or services. So it may be useful to think through with your partners, not just how to make accessing case management and training services easier for participants, but also how to access other needed benefits and services through linking tools or providing information guides or how-tos for participants about how they can use technology to better access public services. Next slide, please. Great, so I just wanted to share some of our links that we have describing related research that I've pulled from for this presentation, and would love to connect with you all if you're interested in learning more or further discussion. So we'll share these slides around and this research will be available. And then on the next slide, I have my contact information if you'd like to reach out to me to connect. So thank you so much for your time and looking forward to the discussion.
Thank you so much, Amanda. I really sort of appreciate that kind of thought about user experience when it comes to technology, especially thinking about, how we can build community, but also kind of, too much technology may not be a good thing, and being strategic about what folks need. So thank you so much. Looking forward to the discussion at the end. I am going to now turn the mic over to Molly Kruger from Climb, Wyoming, but I want to introduce her. So Molly Kruger is the Chief Operating Officer at Climb, Wyoming. And as a nationally recognized expert in poverty alleviation, Molly leads the outcomes-driven operations of Climb, Wyoming. Climb's mission is for low-income single mothers to discover self-sufficiency through career training and placement. Molly's lifelong passion for effecting positive change in her communities intersects with her deep knowledge of mental health, expertise in systematizing accurate data and strong outcomes, and human-centered systems. Holding a master's degree in community counseling from the University of Nebraska and a bachelor's in communications from the University of Wyoming, Molly joined Climb in 2008. And during her tenure overseeing programs, she stabilized families and supported single moms struggling with the unique challenges of rural poverty while growing her team and expanding partnerships to include job training in non-traditional industries such as plumbing and pipe fitting. As Chief Operating Officer, she ensures Climb's continued success by building innovative partnerships across sectors, ensuring efficient and effective stewardship of public and private funds, and creating systems that ensure a relationship-centered organizational culture. In 2021, Climb was selected as one of the most innovative nonprofits in the nation, serving low-income families for a comprehensive case study on the TANF program. Molly is proud to be shifting cycles of generational poverty, one family at a time. So, Molly, take it away.
Thank you, Kristen. And thanks, Amanda. It's helpful to hear what the research has to say, and it's also really validating is to think about the work that we have done. I'd love to start with a video this morning that helps you learn a little bit more about Climb, Wyoming.
You already have your gifts inside of you. Dig deep and know the potential you have and the gifts you have within yourself. Climb wants to be part of that with you.
This is much more than job training.
You have taken the first step.
The first step to changing your life.
That is courage.
You are becoming a person who believes in herself again.
You are more than.
You are more than. You are more than. You are more than good enough.
Take a deep breath.
There may be times
when it gets hard,
where you want to give up,
but we'll be there every step of the way.
Every step of the way.
Every step of the way.
This is a judgment-free zone.
To be able to experience that with a group of women is so powerful.
We're all on this journey together.
We believe in the strengths of
every woman
that
walked through our door.
You deserve to be heard.
You have a voice.
You're amazing, Mom.
I'm proud of my mom.
You can do this.
You are becoming
hopeful, creative,
self-aware,
empowered, fearless,
in control,
beautiful. You are strong,
accomplished. You are valued. You are confident. When you work hard,
you can do
and be
anything. This is to better ourselves. This is for us. It's a safe place to speak up, to speak out.
You have choices about your future.
You have a voice.
You have the power to take charge of your life.
Even after Climb,
there's still a place for you here.
This will change your life.
Just believe.
I am Climb, Wyoming.
Thank you guys for being here. I'm really honored to be able to speak with you this morning, and love to play that video just as a connection to the work that I know you all do and might often not be as directly connected to the people that you're impacting. So thank you for that work. And this video is actually a video we use to help women come to Climb and feel that it's a safe space. And also know that it just impacts all of us to hear a story directly from the people that we're working to really support. So when I think about all of the work that you do, and I think about Climb Wyoming, we are very honored to have a partnership with the state of Wyoming in the Department of Family Services to access TANF funding as a private nonprofit to be able to offer job training and placement to low-income single moms. And so on the next slide, you'll see we're located throughout the state of Wyoming. We have 6 sites, and we're very rural in the work that we do because we're a rural state in general. So we have, in just a quick example, in the Teton area, we have women that will commute 2 hours twice a day to get to the Climb Wyoming program, and really trying to help them figure out what support they need in place to be able to do that. And so, of course, the pandemic really changed that for us, and we ran a remote training that extended beyond that at different sites throughout the state. We had further outreach to really, we've run programs we traditionally run programs in person. Through the pandemic, we ran them remotely and had a couple of groups that never met each other. I'll talk a little bit in a moment about our cohort model, but never met each other, but still completed training remotely from quite far away, and learned a lot in that process. So I look forward to talking more about, I think, helping you see regionally how we're located in the rural nature of our work will apply later in the presentation as well. But at Climb, we really see employment as a poverty alleviation solution. And as you'll see in the next slide, we work with women who are faced with the tough choices of poverty. So the TANF eligibility, as you all, I'm sure, well aware, helps people at 185% of the federal poverty level. And the average Climb participant is at their average is 30% of the federal poverty level. So we're working with families in deep poverty, roughly averaging $500 a month for a family size of 3. And we work with low-income single moms primarily because we find the statistics demonstrate our goal is to help the families in the most need. And most of those in Wyoming are headed by mothers. And so when you hear me throughout the presentation talk about working with low-income single moms, please know a lot of what we learned, we believe, can really be applied to any clients that you're working with or that your staff might be working with, whether it's single fathers or other families or other individuals that come to your organization or needing your services. In this deep poverty, we know many things. We've really learned a lot over time. Climb's been around since the mid-'80s, and we think of ourselves as a practice to theory organization. We've learned a lot from the women that we work with, and they've really informed and continue to inform a lot of the work that we do. So when a mom is making the tough decision about putting gas in her car or food on the table, we know the difficulties of also figuring out a career and job training and applications, and do I qualify and what funding do I qualify for? That's an unrealistic expectation basically for any human to manage, let alone on top of really hard basic need types of decisions. So we work really hard to take those decisions off the table to really support women with stabilizing their basic needs. And while they do that, we work really hard behind the scenes to not have them impacted by a lot of the decisions that we can take away. So just a quick example of that is that when women come to Climb, they don't know that they're receiving TANF assistance. We talk about being a job training program, and we really try to help them know if they show up every day on time, we'll help them by getting them a job and talking a lot about them about the industry that they're interested in, or maybe needing to enter into because of timing and they don't have the luxury of picking an industry, but they need a change. And so they come to us, and we're able to really work with them through our program in a way that helps take away a lot of the behind the scenes paperwork and logistics that are a lot to handle on top of being in a really difficult situation and pretty vulnerable when they come to Climb. On the next slide, you can see just the general overview of our program. So in COVID, we really highlighted the pre-program stabilization phase of our program. We had outreach through, we traditionally have had outreach through about 15 counties in the state of Wyoming, and in COVID increased that to about 18 counties and have a goal by the end of the year to have outreach in 23 counties, because we've realized the value of the stabilization we can offer in a remote context. And when I say that stabilization, I'm talking about things like helping individuals understand their criminal backgrounds so that they can talk about them and go to work and have the documentation they need, getting vital documents referring them to different community resources, helping them with drug screens. We have a lot of women that are worried about being in a place where they might need some help and wanting to make some changes, or in the process of making changes and maybe need some support around having a consistent drug screen to help hold them accountable. So all of those services are really in service of preparation for work. And as I mentioned, if those are just a few, there's lots of different things that we can do and really listen to the women that come in our door to understand what they need as they prepare for work. And in the intensive part of our program, you'll see we have quite the wraparound services. We have really found over time this model really works well to impact long-term sustainable. And one of the things I really appreciate being able to do this presentation 2 times in a row, because I left some things out the first time that you all are benefiting from this time. But when women come to climb, we really pay attention to, so as I in the previous slide talked about executive, I don't know if I talked about this, but executive functioning, the ability to plan, schedule, organize, have emotional regulation, those things aren't happening when you're in the trauma of deep poverty. So what happens throughout the climb process is that we insert them, sometimes overtly, sometimes not overtly, by having a really structured schedule, talking about what's going to happen, predictability. When something changes, we name it, we talk about it. I think that modeling really helps individuals learn what executive functioning is and helps them practice it not only at climb, but then as parents, as they go to work, really understanding how to practice the skills of executive functioning, so that then when they leave the program, they're really in a different spot than when they started. And graduate services that we offer are really in service of job retention. And all of this happens in roughly, the blue part happens roughly in a span of about 12 weeks. The pre-program stabilization could be one day, it could be a couple of weeks, it could be a couple of years that we're helping people prepare for the program. And then graduate services, those are kind of ongoing as needed from different graduates. On the next slide, you'll see just statistics from our program. We really value data, and it's important to know that what we're doing is working. And I'm really excited to share that in 2021, we have 97% graduation rate, 90% of our graduates are employed full-time post-program. But I think what's most impressive is that 2 years post-program, we continue to see a wage increase, or that the wage increase that happened has been maintained. And so that's significant. And this is not unique to 2021. These statistics over time are pretty close to the same, and feel really like we know the slide you just previously saw as a model that really works well. And I'm going to talk a little bit about the how and the why. So if you go to the next slide, when COVID happened, it was really clear that we had to decide what can we let go of and what can we hold on to. And these are the things that we knew we had to hold on to. Stabilization, as we've talked a little bit about already, the cohort model, working with women in groups. Poverty is really isolating. And so we bring women together to be a support for one another, to learn from each other, to have conflict amongst one another, and really practice responding to each other and trying new skills out differently than maybe they would have the opportunity to do if they were doing this training individually. So this is something that we knew, whether it was a Zoom group or an in-person group, how can we hang on to this? This is a really powerful part of our program. And then focusing on employment has always been key for us. Every staff at each of those locations, we have about 40 employees throughout the state of Wyoming at Climb. And each team only has a couple of full-time staff. And one of those staff members' jobs, their primary job is to place women in jobs in the local community. So the training we run is really industry driven. And that job placement is not an internship, it's not part-time, it's long-term placement in a place that really is a great fit for that participant based on her skills, and also the employer based on what they're looking for in their working environment. We knew we could not let go of this. Employment is kind of the tool, the way out that we see of poverty. And it's also the motivating factor. I think that's why women come back to the program, even when it gets really hard. They're doing really hard work while they're with Climb. And a lot of that is because of they know the importance of that job, and they're motivated to reach that goal. I also think we have a lot of flexibility within the program. I like to say that people don't get kicked out of the Climb Wyoming program. That doesn't serve anybody. And a lot of women that come to Climb have experienced not being able to finish something previously in their life. So when they come to Climb and they're really struggling maybe to show up on time or be there all the time, or other things are happening, we just get really curious. We want to know what's happening for them. This isn't working. What's going on? Let's have a conversation about it. The more communication we can have and the group members have with them, I think the more we can understand and better support them. And so we just have tough conversations over and over, and we do outline what are the guidelines, what are the negotiables, and what are the non-negotiables as we think about programming. But it's really important to us that we work with adults as they come to climb in a way that is really respectful and honoring of who they are, and knowing that struggles that we have seen increase exponentially in COVID are real, and there has to be flexibility within our programming to support them into finishing. And so a quick example of that might look like if we're working with a group and one mom is really having a hard time, maybe evicted, maybe having family sick over and over again, or the participant is sick, she might not finish training with that group, and we might work individually with her to finish training in a different way. She might join the next group. I think just really try to think more about what's actually happening for this person. How can we work with them towards a solution that might need to be longer term than this program in the way that we have it set up? And that flexibility has really allowed for a lot stronger of outcomes. If you go to the next slide, one of the things I wanted to also share is that there's really important internal pandemic response that we had at Climb. And so as I talk about this, I'm going to give some examples of how we did things internally with staff, but also how staff then worked with participants, so that you can kind of understand how complicated some of this was. But really important for us to help staff make decisions on their own. So autonomy, really understanding where can they make these decisions if they're going to be in person or not. That continues to happen. So staff will continue to do that. Providing training was critical. How do we help staff get computers to moms? Climb Wyoming has a braided funding stream so that if one funding won't pay for something, another funding will. But when we go online for training, that doesn't mean all the participants also go online. So we really had to figure out how do we provide training for staff so they can provide training for moms, show up with them in their homes, outdoors, wherever we need to help them find internet, get up and going on the computer so that they can make this work. In ad-libbing, I've talked too much, so I'm gonna have to cut it short, but I think I want to leave you with knowing we increased communication, not only with staff, but also staff with moms, really trying to listen to participants. If the training structure 8 to 5 Monday through Friday doesn't work, what will work? What can they commit to? And then how can we design a training that really meets that need? And constant feedback, not only from participants, but from staff, and saying, hey, we've done this way for a long time. This is not working, and this is hard. And can we revisit this? And how can we rethink our resources throughout the state to better support our staff and to better support our participants? So I know all the work you have been doing is hard, and there's a lot of, I don't know if you all are burnt out. There's a lot of burnt out people in this industry, and I think we see difficult situation after difficult situation. And the more we can learn from that and figure out how we can provide programming that isn't a barrier, but is really a support, that's what we want to do. And that's what we work really hard to do at Climb. So I look forward to any questions that you guys might have, and want to give Liz all of the time. She also has great things to say about what's happening in Utah. So thank you.
Thank you, Molly. Your ad-libbing was wonderful. And I think I'm looking forward to kind of a discussion later around sort of this executive functioning approach that you were talking about, and really thinking about how to integrate that organically into service delivery. Because I think it's one of those things, how does executive functioning fit into this hybrid world as well? And sort of thinking of the interaction between those two things. So I will now introduce our last speaker, and then we'll really look forward to a discussion at the end. So I'm going to turn it over to Liz Carver, who is currently the Director of Workforce Development of the Workforce Development Division at the Utah Department of Workforce Services. And she oversees one-stop employment centers and staff throughout Utah, as well as several federal and state programs, including WIOA and TANF. She is the liaison for the Governor's State Workforce Development Board. She has a master's degree in educational psychology and over 20 years of experience working with the Department of Workforce Services in a variety of positions. She's successfully implemented many technical and policy-driven projects to help improve workforce programs across the state of Utah. So Liz, take it away.
Thank you, Kristen, and thank you to Amanda and Molly. I love that we have so many amazing women that get to share some of these practices, and also thank you to those who put in so much hard work to organize this event. I think it's really important to come together in this space and be able to talk about these things. So just a quick shout out to all those who have worked so hard to put on this event for us. So I wanted to just talk through a few things, and you can go to the next slide today that we've had in Utah. And I wanted to start maybe with some background, some things that happened, that we had set in place before the pandemic, before all stuff got crazy. And really where we started is we really just tried to start expanding services electronically just to make things available and more accessible. And so we have things like our employment plan online. Our employment counselors could send text messages and emails through our system and receive responses through our system if that's how someone wanted to interact with us. We had lots of forms online. We just made all sorts of things available electronically. And then we also started using Google products and started becoming familiar with some of those, some of the shared documents and some of the Google meetings, all those kinds of things. So we had all these things in place where we started to just try to make things more accessible. And I think partly just because we have some really rural areas of Utah with no public transportation. And I know there's several other states that are like that, but just trying to expand and open up opportunities for people to access things. And our state has really focused on access to broadband, even in some of those rural areas. And so we wanted to just open things up and really help people have access. Let's go to the next slide. And then, of course, we all know that we had this crazy thing that happened, this pandemic, and we had to shift a little bit. Our offices were really only closed for a couple of weeks. For the most part, our strategy was in the state was to try and shift things where we could to open up space and have fewer people coming in. So rather than stay closed, we really focused on just shifting and trying to get fewer people in the office. And so we started doing things like having, phone meetings. Of course, we like everyone else in the entire world started trying to order web cameras and laptops and all those kinds of things that were really, in some instances, are still difficult to get a hold of. And tried to shift as much as we could that way. What you're seeing here is a virtual job fair platform that we procured during that time period so that we could prepare as things started opening up to get people back into the workforce and do it in a safe way. We also just really started looking at how can we provide more things virtually. We did virtual workshops for people. So instead of doing in-person workshops, we shifted to virtual. And like many of you, we just really looked for opportunities to leverage the technology we had and what other technology we could engage at the time. Let's go to the next slide. And so what does the sort of the new normal look like for us? And I actually even hate saying those words because I feel like this is something that we just all are talking about, this new normal. But really what we talk about is hey, we had some good things set up before. We were already talking to people about teleworking. We were before COVID, I like to call it BC, before all that craziness happened, we were trying to expand jobs to rural areas of the state. So we had already brought in to our labor exchange, we brought in jobs that allowed for teleworking. We were already educating people on teleworking before the pandemic. And now we're in this world where it's more commonplace. People are more aware of it. And we had this thing where we have I will say that all of our employment counselors right now, most all of them are working in employment centers. So even when they're having virtual meetings, they're doing it from the employment center. And I'll explain a little bit more about why in a minute here, but really that just having all of those staff in the center. And then we have some of our support staff who don't have direct interactions with customers, writing policy, doing training, those kinds of things. They're all working virtual. So we have this kind of hybrid model and just looking at, can we expand telework? We know that increase of gas costs, just cost of living overall. It's difficult to hire people right now. What can we do to help individuals, be able to enjoy their jobs and also interact with people? So we started exploring all those things. We continue to allow for phone calls and video appointments using the technology we have. We continue to use all of the things that I mentioned before. We also have some licensed clinicians that sort of can do some initial engagement with people to try and help them connect to long-term treatment if that's something they need. And we purchased medical Zoom licenses for them, so they had a safe way to interact with those individuals, and they're using those. We still allow people to come into the office. We want people to come into the office if they need that help. We allow for walk-ins. We have in-person appointments. We still do home visits to people's homes if someone needs that, or we haven't heard from them in a while. They seem a little disconnected. We will still go out to their home. We still allow in-person services to apply for services, to use our computers. We still do both in-person and virtual workshops. So we're kind of in these two worlds right now. Let's go to the next slide. So as we've been exploring, what can we do? We pulled a group of customers from a 6-month time period, and we said, let's call a sample of these. And we did a random sample, and we had 2 individuals who are not attached to any of our operations or anything, sort of people who don't have a dog in the fight and could carry out a survey with someone and gather feedback. And it was really interesting as we talk to customers. And you can see on here, 92% of respondents use a smartphone to connect with their worker. That's either via text, via email, phone call. 63% said they felt comfortable with online meetings. I can almost guarantee if we had asked about this prior to COVID, that number would probably be a little bit lower. And then we had 33% of customers who still were very adamant, they still wanted to meet with staff in person. Some of the comments were really telling. And so I want to share some of those. One customer said, I like one-on-one in person or over the phone. Video is okay if my daughter has a fever or something. I'm okay with it occasionally, but strictly online, I wouldn't like. In person first to establish a relationship. I think it's better because it's awkward when you've never met the person, but I'm fine with online meetings. We also had, I would really like virtual appointments because the gas money is hard for me when I have to drive to appointments. We also had video calls are really great. My last counselor did those for me because I have an 8-month-old, and those were so helpful because I don't have transportation, and that plays a big role for me. And weather plays a big role for me. We also had in-person's hard for me with my kids and mental health, but I can do it on occasion. I really enjoy the connection I have with my worker when I was going in person. So you can see this theme of like this kind of contrasting, like I want some virtual, I want some in person. As we did this, we also talked to our staff. What do our staff want? We see our staff as part of that customer voice, and we talked to them and said, what do you want? Some of our staff had shifted over to help unemployment insurance and then had come back. And some of our staff really just wanted, they were sick of teleworking. They were like, look, I want in-person interaction. I'm a people person. That's why I'm helping people. Some of our staff said, 1 day a week or 2 days a week would be fine teleworking because I can get a lot of stuff done, but I really like that in-person interaction. And then some people just wanted to telework altogether. And so we kind of looked at all of that, and we're still in the process of saying, what would that look like? We're trying to balance out, how can we have office coverage, meet the needs of customers, both our employment counselors and our families that are coming in. And really still trying to figure out what does that mean and how do we cover that? So we're still in the process of like exploring, is there an opportunity to open up a little bit more telework, even though we're in this sort of hybrid environment? So the next slide, please. So as we've looked back at all these things that we've learned in this what seems like a really long period of time, but has been extremely short, there's some themes that I think that we've learned, and I want to spend just quite a bit of time here, or a little bit of time here, because I think it's important. The first is the customer voice. And I think you've heard that both from Amanda and Molly, but that customer voice is just so important. Finding out what is that customer experience like? What does it mean to them? What does it look like to them? And including your employment counselors or your staff in that customer voice, because they are one of the customers. So kind of looking at all the stakeholders involved and what are their needs and their wants and their desires. And sometimes those don't always match up. Like as you saw in our in some of the comments that I read from customers, there's this right now for us in Utah, there's this desire for a mix. And so just, I think, really focusing on that customer voice. And I think yesterday we mentioned that customer voice doesn't have to be a big survey. Sometimes we think about that as a big survey or a big effort, but it can be, I think Amanda and Molly mentioned this, it can be one-on-one. As I first engage with that person or that family, what works best for you? How can I best engage with you? Or how can we best have conversation? How can I best support you? Does that, or text message is good? Do you like to meet in person? Is it, do you want me to meet you at this location? Whatever that looks like for that person. And then I think it's important in this virtual world to find ways to create connection. And we had a great icebreaker earlier that just had a couple of questions that helped create connection. And I think it's so hard sometimes in this virtual world to create connection. And so not just connection with our customers, but also connection between staff members, because that's something we see when we have, so again, we have some staff that are in the office full time, then we have our program staff that aren't. And what we started to see is there starts to be a disconnect for those program staff who aren't coming into the office. And so just trying to intentionally create ways for connection. Things like, I think I mentioned yesterday, we did a virtual lunch where people will just bring their lunch and just have conversation that's not related to work. Another example that I didn't use yesterday, but sometimes we will send like a group text message that will just say, how's your day going? Send a meme telling us about how your day is going. Right. And so just some of those things where we can like laugh together and kind of just enjoy and create some of that connection. Another thing is just, do you have the technology support? It's difficult to get all the things that we, some of the technology is still difficult to get. We've got these buzzwords in society that never existed before, like supply chain. But when I say that, you all know what I'm talking about. And so do we have the technology support? And I think Amanda talked a lot about this, like, do we know how to use it? Do our customers know how to use it? And that's the sort of the next bullet point is like that technology and troubleshooting. If you're a technology person and you're trying to troubleshoot long distance, that can be really difficult and complicated. And so what does that look like? And do you have a structure for that? And do your staff feel comfortable with the tools? And if they don't, are you setting things in place where they can practice? That's one thing that I didn't mention yesterday, but that we did with our online workshops is we had run-throughs, dry run-throughs, and we really practiced that. What does that look like? Oh, I can't do this workshop from home because my internet doesn't support it and there's glitches, or just doing that dry run-through and trying to see like practice, and it helps staff become more familiar with it so that they can then turn around and help customers or families troubleshoot. And then I think another important thing that we probably don't talk about enough is do you have a policy that your staff can go back to, that they know what the expectations are for telework or remote work or virtual work, even if it's in an office? Do they know what the core business hours are? Is that important to the work that you're doing? Is it important that they be logged on for certain core business hours? And if so, is that in your policy? Are there video expectations? Is there a certain way that you want people to dress? Is it expected that they have their video on? Are there expectations for certain bandwidth for them in order to be able to do work? How do you keep track of all your equipment? If once equipment's distributed, how do you provide technical support for that equipment when a computer stops working or you need a new computer? How do you provide training? Do you have formal agreements? How do you make sure that data stays secure when it's in a home environment? How do you make sure that customers have privacy? I think Amanda talked a lot about that, like making sure that we have the right things in place. And how are you going to evaluate performance? And I think that's another thing is just, when someone's in an office and they're meeting with a customer, they can really, you can overhear and you can coach, right? You can coach those engagements, and you can get, if someone's struggling with motivational interviewing, or if they're struggling with connecting with customers, you can overhear that and connect. It's a lot more difficult, and it has to be more intentional in a virtual world. And so what does that look like for you? Are you able to, how do you know that work is happening, or that someone's struggling, or that things need to be, that coaching needs to happen? And how transparent is that? I know, for example, some phone systems, you can listen in and people are unaware that you're listening in on their call. And of course, you have the little tagline that talks about that this call might be monitored. But what does that look like for you and for your department and for your customers? And then, how do you close that loop and have that feedback loop where you're able to, again, provide feedback to someone? Because sometimes, again, just like it's difficult to create connection for teams and create connection for families, sometimes it's hard to create connection for leaders to staff members. And so just building all those things in and thinking through, what does that look like? And then, do you choose to do home visits? Do you choose to go out and validate that the workspace is secure, and that someone is doing what they say they're doing? Or what does that look like for you and those that you're working with? And so just kind of, these are some of the things that we honestly are still trying to think through. We've got some policy out there. We train on policy so people know what the expectations are, because we've got this hybrid model. We've got people who are in the office, right? And their expectations are probably a little more clear and set because they've been there historically. But then we also have those that have moved into this telework world. And so, just making sure that they're aware of the policy. And so these are all the things that I think we have learned, and I'm sure we'll continue to learn as we go through this process and this experience. But I think that if you're looking to move more this direction, these are some of the things that I would say are probably, and they align. I think you've heard both Amanda and Molly talk about the same thing. So a little bit of repetition here, but anyway, those are kind of some of the things we have going on in Utah. And I will turn the time back over to Kristen.
Amazing. Thank you, Liz. Again, it's nice hearing these for a second time as well, and really thinking about all the great work that you're doing. I really appreciate that create connection piece. And so I want to open this up for Q&A. So folks, feel free to raise your hand through the Zoom feature, type in the chat box, you may come off mute. While folks are thinking of questions, I'm gonna throw one out to the group. And I sort of want to build off the start that Karen gave us today around self-care. And I think, that's a theme throughout these three presentations. Amanda was talking about, being flexible in staff scheduling in this moment, thinking about how we can provide self-care for our staff who, are under a lot of stress and having to, continually adapt to this changing environment, to our new normal. So I wanted to open it up to all three of our speakers to add anything sort of around this, how, create connection piece. How can we promote that to support our staff in this moment?
I'll take a stab at. I think it's different for people in offices than it is for staff that are working virtually. So I think for some of our staff that have been working virtually, we've intentionally added different activities and talk about self-care. What are you doing for self-care? For example, we had an activity that we did with a group of our staff where we talked about how important it is to get out, and especially when you're teleworking. If you're in your home, how often are you leaving? And so we said, take a 5-minute break. The invitation to everyone was take a 5-minute break and go outside. What do you hear? What do you see? What do you smell? And just connect, really ground yourself with those senses, and then come back and share. So, just providing little activities in that. And the same thing can be done in office. It's just a little bit easier in some aspects because you can have, you know, as you're having your staff meetings or you're getting people together, just really talking about that. What are you doing for self-care and having some activities associated with it.
I'll add a few things. We oftentimes revisit the structure, our meeting structure, our email structure. I think oftentimes things are put in place and they work great for a while and then they don't work anymore. So I do think leadership has a responsibility to support the people you're working with checking in. Are things working? Are they not working? I think that goes a long way. It's not as direct of a connection, but it's, hey, we're paying attention to this. We're paying attention to workloads. We're thinking creatively about how to make our workflow more supportive. I also think that communication is key. So regular communication, finding time in meetings to connect, to start with a little icebreaker. There's a lot of brain science behind when people feel safe and the structure is supportive to how people get their needs met at work, they're going to be more productive. So it feels sometimes we say all the time, go slow to go fast. I think taking time to build a relationship, prioritize relationships when you can prioritize in person. I think it's great. When you can't, figuring out ways to connect in a remote capacity, which is nearly as fun, but is still doable. I think that's critical. And leadership within climb, oftentimes just paying attention to little things that are make a big difference to people, noticing important dates to them, just recognizing work that's happening, being able to pretty regularly share gratitude and just noticing what's happening. I think that those are all important connections that are meaningful to staff.
Yeah, and I'll just add to what Molly was sharing. I think just with those open lines of communication, understanding what people are most comfortable with and what their best skill sets are can help also pair people together to share learning across different things they might be working on, or if someone's an expert in a particular type of digital engagement and they're really interested in doing more of that with customers, maybe they could take more of that on, whereas someone else could step away from that and really work on a different aspect of their work that is more in line with their skill set. So I think just trying to figure out with people's different skill sets, how they can meet the demands of different methods of service delivery without feeling completely overburdened and like they have to do everything is something that we've been hearing from organizations has been helpful to them.
Thank you. Anyone from the audience have a follow-up question to that or a question they would like to ask of our amazing panel? Right, I'm scrolling through to see if anyone has their hand raised.
While you do that, Kristen, I just wanted to tag on to what Amanda says, because I really agree with that. And I think we try to have a space in our work culture that we talk pretty openly about what we're really good at and areas we're not good at. And that is like really immediately takes the heaviness out of tough conversations and then can really, I think, make workflows efficient. Because if I know I'm not great at something and I'm really willing and comfortable to talk about it and somebody else is, it just really helps. So I wanted to underscore what you're saying, Amanda, because we see that a lot, and it's sometimes really hard to do, to talk with staff and have staff talk about what they're good at and what they struggle with. And I think it's key.
I appreciate that, Molly. And I think taking that strength-based approach and thinking about what I'm good at and what I don't want, I'm not great at, and thinking about workflow. And I think that's something, that folks do with their customers as well, right? Is thinking about those strengths and working through kind of, what they need based on their strengths and what they want to do, what they want to learn, things like that. I asked this question yesterday and I'm going to ask it again because I think we have a moment really to step back and talk about equity. So in Amanda's presentation, she talked about equity-centered services. And I really would like to open it up to our panelists to talk more about, how can we think about equity-centered services? What are some best practices around equity?
I'll start. Everyone, we're looking at each other, but one of the things that I think sometimes maybe we talk about the inequity of like maybe digital literacy, and I think helping individuals who lack digital literacy and being in a safe way, helping them learn about digital literacy or learning about or becoming digitally literate is probably a better way to say it, is something that maybe we don't think about because so many things are turning digital that it creates further inequity when you aren't familiar with that or don't know how to use platforms. And so the more that we can help individuals engage and learn about literacy or the digital world and technology, I think the better we help prepare them to sort of step out of that. And there are some issues with access, and I think the more that we can help them access technology, but it's also not just about, sometimes when we talk about digital literacy, we're saying, oh, well, there's not broadband or there's not a physical computer, but some of it is if you haven't used that, you don't know how to use that. You don't know what that means. And so I don't know, that was just a thought that I had, is really focusing on more than just access to digital or to technology, but also like, do we know how to use it in a safe way that's not, because sometimes it can be really intimidating, especially if someone knows how to use technology. And so just doing it in a safe way, I think.
I'll add, I think that learning is key here, and providing equity-centered services, I think, is ongoing change. So really helping know that you have training in place for staff, whether it's terminology or we have found in our kind of standard application process, we were missing really important questions that led, once we reviewed our paperwork and added questions that really helped CLIMB have a more inclusive application process, we realized we were missing really valuable conversations that weren't safe because we weren't asking questions we needed to be asking. And so just thinking organizationally, how do you ask questions? What are you asking? What are you not asking that might foster certain conversations that might be very uncomfortable, staff might not be prepared for? And then how do you get staff training so that they can be prepared for those conversations? And I think terminology is a great safe place to start. And then I think really getting into what does this mean for different staff? How do they, staff might have bias. And so what's their awareness around their bias, and how can our staff, we always think about how can we show up with curiosity and less defensiveness is a great way to really help people feel included and welcome as they come to your organization. And I think that topics can sound so political in ways that they can be easier to avoid. And I think instead leaning into them with a lot of safety and structure, I think really help staff provide service that is really equitable as people come to you or the people that you're working with. So those are a few thoughts. I also think paperwork can really get in the way. So one of the things we did really quickly in COVID was we had staff sending kind of packets of information out, like we need you to fill this out. And we just immediately stopped that process and said, let's just talk to people and let's just fill out the paperwork as you talk to them. And let's do this really differently, because this is not the thing we want to prioritize right away. We really want to connect with people and see how we can help them. And then we'll get the details that we need. But just, I think removing some barriers like that are also ways that you can have equity-centered services.
Yeah, I think those are all great. And in a different context, in the Department of Labor program that we're working on, an assessment of, we're thinking about some of the strategies that their programs used during the pandemic. And some did really innovative things around moving intake processes online to open up more staff time for case management and really getting to those one-on-one needs of participants and being able to focus services more equitably around individualized needs. And sort of a counterpart to what Molly was saying, some programs actually sent sent out packets to participants just sharing how to get online. So kind of describing the process of like, this is how you open the computer, this is how you type in the address, this is how you, just to get people started. And then, now those paperwork books aren't as necessary because things are going back into more of a hybrid and in-person format. But the programs will always have that for the future if there's ever another health emergency, God forbid, or something else that happens. So just having these different ways to engage with people who might be at a very, very basic or have no digital literacy at all, to what Liz was speaking to. How do you get started with technology if you don't have that one-on-one exposure in person with someone? So I think there's interesting things that programs have started to do around just getting people to engage, just to start, because it can be so overwhelming, especially for people that may not have ever used certain technology before. So.
Yeah. So we have about 4 minutes left. Is there anyone from the audience that would like to ask a question? You can feel free to type it in the chat as well. If we don't have time to fully answer it, we can always follow back up with you. I appreciate the answers to that question, and I think it sort of brings back this theme of learning styles and adult learning and thinking about how different we all learn. And so that sort of ability to talk to customers, talk to staff, think about what people need in terms of how they're going to learn best. So that's a theme, I think, throughout the 3 presentations. And once when we send out the PowerPoints, that's something I think, if you're the kind of person that learns by having to go back through the presentation and pulling out key themes, that's something to look at, is really thinking about, those learning styles. So I want to close us out. We're starting to count down here, and I want to thank all of our great speakers, Molly, Liz, and Amanda. Again, wonderful presentation. Thank you so much for your insights around this new normal. And I want to thank all of our participants for joining. So we look forward to seeing you all throughout the rest of the day.
Thank you all.
Thank you.